Good evening, members. I'm reconvening the Human Services Policy Committee. Could everyone please take your seats? I do note that we do have a quorum present. I want to welcome everybody back. We have got 4 bills tonight. We did have one that was pulled, and we have an informational hearing on tonight's agenda. So I want to say thank you, everyone, for being here. I know that we've got a lot of work that we are trying to get knocked out as deadlines start approaching. The first bill we have this evening is going to be House File 1851. It's a Representative Hicks bill, so if Representative Hicks would like to move to the table there. And Representative Hicks, if you'd like to come down and move your bill.
Thank you so much, Chair and Committee. I would like to move my bill, but I also have a DE author's amendment.
Okay, Representative Hicks has moved her House File 1851 to be referred to Human Services Finance. And you have a DE1 author's amendment. If you'd like to move your DE1 author's amendment.
Yes.
And then this is to get the bill in the shape the author would like. So if you'd like to make the motion, please.
I would motion to move my DE amendment.
All right. Representative Hicks has moved the DE1 amendment to House File 1851. This is to get it in the shape she would like. Are there any questions? And I'm going to hold off on having her explain it because basically it's her bill, and so she'll go over it when she does her bill introductions. Any questions? Hearing none, all in favor on the DE1 author's amendment signify by saying aye. Aye. Opposed? The motion carries and the DE1 amendment is adopted. Representative Hicks, please explain your bill as amended.
Thank you so much, Chair and members. I have collaborated with Family Service Rochester, AARP, the Minnesota Chapter for Alzheimer's Association to revitalize the Live at Home grant program by bringing much needed updates and increased funding for the first time in years. The Live It Well Home Grant Program is a proven resource to keep seniors living where they want to be, in community and with people they love. Seniors want to stay in their community. They want to stay in their homes, but many cannot do so without help. The flexible grant funding distributed through the Live It Well Home Grant Program funds the services seniors need, including things like volunteer respite programs to help give unpaid caregivers a break. Across the state and in tribal nations, making sure that our seniors can stay in their homes. This is good for seniors, but it's also good for our families and our unpaid caregivers, our communities, and overall the state of Minnesota. Minnesota's family caregivers are currently acting as the backbone to our long-term care system, and they play an essential role in caring for their loved ones and delaying expensive nursing home care by their labor of love. The Live at Home Well grants support these caregivers as well. House File 1851 brings this much needed support to the Live It Well Home Grant Program and the necessary infusion of new resources at a time of great need. If we want to support seniors living in the community, we need to take action now to invest in the programs that we already know work and have a proven track record. I will turn it over to my testifiers to give you more detailed information about how the program works in our communities.
Very good. And am I correct? The first testifier we have is April Suter.
Correct.
If you'd like to introduce, welcome to the committee. Please introduce yourself and begin your testimony.
Honorable Chair, Assalamu alaikum, good evening. I'm April Suter with Family Service Rochester and the leader of our senior independence work. Along with mental health and child family well-being, Family Service Rochester provides home and community-based services with older adults in Olmsted and Rice counties in southeast Minnesota. Our paid staff of 9 people and 800 plus volunteers help upwards of 1,000 seniors and persons with disabilities to remain living in their homes and communities. Over the past 8 years, we've diversified our funding to create greater stability and expanded senior independence services to a growing number of rural communities who lack services. Volunteers form the core of our service delivery model, which includes Meals on Wheels, respite, evidence-based classes, chores like snow removal and lawn care, transportation, housekeeping, grocery delivery, falls prevention, handiwork, home modifications. In 2022, more than 800 volunteers gave 44,942 hours of service. That equates to 21.6 full-time staff. In 2021, it was 40,124 hours, or 19.3 full-time staff. In 2022, of the 42,861, yep, we're good at keeping records, of the 42,861 tasks completed, volunteers completed 39,911, or 93% of all the services provided to seniors. 3 local advisory councils guide our work. We utilize a cost share model where consumers contribute to the cost of services based on their income. Consumers do contribute to the cost, and volunteers keep services accessible and affordable. Housekeeping and handiwork could cost as little as $6 an hour for low-income consumers. Despite our diverse funding streams, consumer contributions, and remarkably dedicated volunteers, sustainability remains a constant struggle. Family Service Rochester has been fortunate to receive DHS Live Well at Home grants for a number of years. Under the existing legislation, these grants have helped us expand to small communities and rural areas and continue to innovate. However, the current Live Well grants are generally for only 1 year and not meant for stable long-term support. This lack of stability presents a serious challenge when trying to sustain needed services for low-income seniors unable to afford the covered costs. So, likewise, in rural areas, senior populations may simply not be sufficient in numbers to provide a minimal consumer base necessary to support service providers. For successful programs like those once present in La Crescent, Albert Lee, and Chatfield, the loss of a grant like Live Well meant programs closing their doors. Seniors don't go away, and their needs don't stop just because funding does. With no services, seniors have little choice but to move to residential facilities where their resources are quickly depleted, and then they turn to the government for support. Providing services that help older adults age in place saves government and, in turn, taxpayers money. A senior receiving multiple services through Family Service Rochester might pay up to $2,000 a year, while they could pay more than $2,000 a month at a facility. Stable, renewable, foundational funding to organizations who deliver on their proposed outcomes is what we need and what we seek through this legislation. Doing so builds statewide capacity and stability for home and community-based service providers and family caregivers. Help us meet the growing needs of the fastest growing demographic in Minnesota, older adults, in the most cost-efficient manner in the environment of their choice, the homes and the communities they know and love. Thank you.
You're welcome, and thank you for your testimony today. Next, I have Barbara Oman. Excuse me, Barb Oman, if you'd like to come down, please. Good evening. Welcome to the committee. Please introduce yourself and begin your testimony.
Thank you. Mr. Chairman, members of the committee, my name is Barb Oman, and I'm a volunteer for Helping Hands Outreach. We're based out of Holdingford, a town of about 750 people in central Minnesota, but we serve an area of over 200 square miles. Helping Hands started about 20 years ago by community members because they recognized there were so few services for seniors and people who had mobility challenges in the outlying areas, the rural areas like ours. Our program is truly the community coming together to help one another. Most of our services are provided by volunteers like me who give rides, help with light housework and chores, offer breaks for family caregivers, and make friendly visits. I grew up in the area and started volunteering for Helping Hands when I retired from teaching. While I knew how important their work is, it's so rewarding to see firsthand how something as simple as giving rides not only enriches my life, but makes it possible for my senior neighbors to continue to live in their homes. One such person, I'll call him Frank, was a teacher at my high school. Frank loved our community, volunteering himself for our fire department for many years. When Frank's wife was diagnosed with cancer, he was her primary caregiver, as they had no children. Attending the Helping Hands weekly lunch gave Frank the support and community connection he needed as he cared for his wife. In 2020, Frank started to have some serious health issues of his own and could no longer drive. Helping Hands stepped in and gave Frank over 100 rides to his many doctor appointments in St. Cloud. It's important to note that even during COVID, Frank and others could count on Helping Hands to get them to their doctors safely. Frank was a quiet man, but he felt very comfortable talking during those rides with me because we knew each other from our community, from our church, and because we were neighbors. Connections like this are one of the many bonuses of a community-based program like Helping Hands. Frank's last ride from us was just a week before he passed away in his home last fall. Frank was able to die at home because of the support from Helping Hands. Without those rides, he would have had to move to St. Cloud, and Frank desperately wanted to stay in his home and the community he loved. This is just one of the many stories of how Helping Hands has made a difference in helping seniors stay living in their homes and communities. Thank you.
Thank you so much for your testimony. Next, I have Carol Lundquist, if you'd like to come forward, please. Good evening. Welcome to the committee.
Good
Please
evening.
introduce yourself and begin your testimony.
Mr. Chairman, members of the committee, my name is Carol Lundquist. I am the Executive Director of the Living at Home Network, which is a statewide network of 32 small community-driven nonprofits, independent nonprofits, like Helping Hands, that draw their resources from their communities to help older adults stay living in their home. I was the former executive director of Helping Hands Outreach. In the Metro, there are neighborhood residents who have gotten together to help seniors. And in small towns like Holdingford, it's community members committed to help each other. This proven cost-effective model has been especially successful in hard-to-serve rural parts of our state. Overall, our network served over 8,000 seniors and had over 54,000 hours of volunteering last year. Our block nurse programs have received grants up to $60,000 per year through the core category of the Live Well at Home funds. This category is designed for small, low-budget nonprofits that serve a defined geographic area to provide volunteer-based services. But the funding in the category has not been increased for the last 10 years. We see the need for $1 million for the biennium to be added to the core Live Well at Home grants so that new communities can serve their seniors in unique ways and our current programs can meet rising costs and continue to serve their senior neighbors. We support HF 1851, providing ongoing funding for projects and services with proven outcomes for older adults to give a much needed funding increase for community-based services for older adults. Thank you.
You're welcome. Thank you so much for coming down today. Next, I have Leif Greena. If you'd like to come forward, please. Good evening. Welcome to the committee. Please introduce
I'm
yourself.
glad to be here. My name is Leif Grenna. I am president of the Minneapolis Regional Retiree Council, a constituent body of the Minneapolis Regional Labor Federation. Our council is made up of 19 local union retiree organizations, and we are actively engage our membership in education, public policy, and voter turnout to ensure elders have a voice in the public arena. As we know, Minnesota is facing a rapidly aging population. Some call us a silver tsunami. The vast majority of elders wish to remain in their homes and in communities that are familiar and feel safe and secure. That is, to age in place. We know that elders who remain in their own homes help their communities and the state by holding down the costs of institutional care and have better emotional, mental, and physical health. According to a study by the University of Missouri at Columbia, quote, aging in place preserves seniors' independence and reduces care costs. In a 4-year analysis of aging in place, the total care costs for residents were thousands less than traditional care options. Costs for living and health care never approached the costs for nursing homes and assisted living services. In addition, aging in place residents had improved mental and physical health outcomes. Over the past year, our council has researched various barriers seniors face to aging in place. We found that the desire to remain in one's home does not vary by income or health or where one lives, but often a minor thing is a barrier: a ride to go shopping or to the doctor's office, someone to shovel the sidewalk, or do simple household chores. And larger barriers exist as well: the need for an access ramp, a furnace repair, a visiting nurse. But services like these are fragmented, underfunded, limited by eligibility, are often unknown to seniors who need help. We have found that it is a nonprofit agency, such as you've heard about here this evening, operating at the community level, that does the best job of helping seniors navigate the complexities of service that may be available to deal with the barriers they face. Being in the community, they are best situated to help. Strengthening of the ability of these nonprofits with better funding will be a positive step in making community-based services more available. And we support expanding these services to more seniors without regard to income levels. Middle-income seniors, no less than working class and low-income seniors, face barriers, and their ability to pay for some of the needed services costs can only help make things fairer, as well as meet the intent of this legislation. Getting old, it has been said, ain't for the faint of heart. Indeed, many elders are among the bravest and most stoic people I have met as they navigate the physical, mental, and emotional challenges that getting old presents. Supporting us through these years is not about a handout. It is about encouraging a brave heart. We urge your support for this bill. Our population is aging. We are not about Minnesota's past. As Minnesota ages, we are about its future. Thank you.
Thank you so much for your testimony. Is there anyone else from the public that would like to testify on House File 1851? Not hearing any. Members, are there any questions or comments? Representative Keel, and then Representative Baker.
Thank you, Mr. Chair. These living at well at home grants, I've seen work very well. I noticed that in the bill, it is Representative Hicks. My understanding is that it's expanded from not just a community to a county area, so that in my rural area, it serves people that are in the country too, correct?
Correct.
Okay. Thank you, Mr. Chair. And then, what else was I going to say? Do we think we're going to have problems with DHS funding this extended? I noticed there's, the appropriation's fairly good size for the state, because we're talking about a state.
Yep.
The whole
Representative Hicks?
state.
Yeah, so it is the entire state. I will phone a friend if there's any concerns from DHS or anyone else. Anybody can come down. But, you know, this isn't a new program. This is really just
Correct.
kind of making it more robust and hopefully strengthening where we are currently.
And it appears we have Mr. Burdick. If you'd like to introduce yourself, please.
Thank you, Mr. Chair. For the record, Matt Burdick with the Department of Human Services. And thank you, Representative, for the question. We have been working with the author and the proponents on this language and really do support the direction that this is going in. I don't believe we've yet completed the fiscal note, but any administrative resources we need to make sure that we're accommodating that, the work of the department will be contemplated in the fiscal note, and we'll be sure to talk more about that at the Finance Committee.
Okay. Representative Keel?
Thank you, Mr. Chair. Appreciate that. Mr. Burdick and I had conversations earlier about how we're expanding the opportunities for people as they age. So it gives people a choice. I think it's a good program because not everybody wants to leave their home, can stay at home. But it isn't always the case. So we, you know, having the multiple different kinds of options for people to live their best life, I would say, it isn't always where they want it to be, but to give them the independence that we can possibly do. So thank you.
Thank you, Representative Keel. Representative Baker?
Mr. Chair and Representative Hicks, I think, and I know this program pretty well, the block grant stuff, I think the Ms. Lundquist is the one who kind of covers our area in the Wilmer Atwater area. I think we've got a great program out there that I've supported. And one of the things that concerns me, well, not concerns me, the program is amazing. And I'm glad you're expanding it. I think it's, what I'm wondering about is the volunteers, local communities get the block grants, and then they hire people and they give them, is it stipends to help people drive around? Is it an hourly wage? Help me a little bit understand the folks in our communities that do the work and help people. Are they actual employees? Are they independent contractors? I just want to better understand that if I could.
All right.
I will let some
Representative
more
Hicks?
folks explain that.
Okay.
And tell me if I'm wrong, but I do believe maybe it's a little bit different depending on the different organizations.
And Ms. Suter, go ahead.
With our program in Rice and Olmsted counties, our volunteers are volunteers. They don't get paid anything. And we have 800 plus who are providing transportation and all of the things that we do. For 93% of what we do, it is unpaid volunteers. That is, it may differ. Some organizations give some stipends, or they might give gas vouchers.
Okay.
So.
Representative Hicks?
And I would just like to say, you know, I think what's important there is to understand that the control of what makes sense for those communities is in with the nonprofits that know those communities, right? So in Rochester, for example, we have a lot of people going to different healthcare field schools that may require they do some volunteer hours, right? So there's some opportunities there. Other communities may have different barriers and different strengths. And I think trusting our community members to help our community members figure out what makes sense is really a good use of taxpayer dollars. Because as it stands right now, and you both know this, because we've talked about it in here quite a bit, if people don't get the support they need to stay in their home, where do they go?
Right.
Representative Baker?
Yeah, Mr. Chair, I think what I was trying to also understand is, and again, if they do it differently in the other areas, if they're employees and they do get paid something, House File 2 is going to have an impact on this too. I was going to ask about just that the paid family leave thing is going to affect everybody, including our nonprofits. If they're getting stipends, it's probably not going to affect that. If they're getting reimbursed for gas cards, probably not another issue either. I just want to make sure that we're recognizing this new thing that we've been talking about. And if our folks in the field are thinking about this, are concerned about it, are wanting it, I would love to hear from our folks here too on that issue. So not today, we can do it another time, but this is an important question that we have to ask anybody who's going to have people working for them.
Representative Hicks.
So that keeps coming up in this committee, and I just want to be really clear. We're talking about 35 cents per every $100 in wages. And as somebody who worked in a nonprofit and ran a nonprofit for 10 years, a $5 million program in a nonprofit, there is a certain level of the cost of doing business, right? Like some of these things are just part of that. But the other piece that I think it's important to understand when we talk about nonprofits is that nonprofits are just as passionate about their people that they employ as they are about the people that they serve. And so I just think it's important that we remember those components, and people who work in this field are very passionate, and they're very passionate about their staff as well.
And I guess I would like to,
And I'm sorry, it's
Carol
Carol
Lundquist.
Lundquist. Yes.
Yes.
Go ahead. I have to recognize so that when somebody listens to the tape, they know who's talking. So thank you.
I would like to address that also, just to talk about our programs, which we have 13 in the metro and the rest are outstate. So basically in our programs, the majority of them have 2 staff people. I come up from a program where we had 4. We had 2 full-time people and 2 part-time people. So the majority of it in the programs, transportation, the services are done by volunteers. It is up to, we offer our volunteers at Helping Hands a stipend, mileage if they so desire. The only time we are ever taken up on that is if our volunteer has to drive someone to a medical appointment in the Twin Cities. So I do know some of our some of our programs do offer their volunteer drivers gas cards. We've been working with the Volunteer Driver Coalition to try to make just the mileage reimbursement for a volunteer up to what we all get driving for business. Does that help some?
Yeah.
Okay.
All right, thank you.
Yes, Mr. Chair, thank you. And again, I appreciate that. I think I just want to make sure that, again, I'm glad this is expanding, but I want to make sure that this is being recognized as kind of a new way of doing things in the state. So I appreciate this program. I will support the bill. I just want to make sure that our partners in the communities know there's other stuff coming too. So appreciate the comments. Thank you.
You're welcome, Representative Baker. And then did Representative Edelson, did you? Or I was just misunderstanding your signs before.
No, I was, thank you, Mr. Chair. I was just going to say I had looked up the Live Well grants online, and I'm just emailing them to Representative Baker because when they get them, they detail what it's for. And so like it's the testifier talked about transportation, stay-at-home kits, repair services. It looks like there's a whole variation. I just wanted to, I just emailed it to Representative Baker.
Thank you, Representative Edelson. Not seeing any other comments or questions. Representative Hicks, would you like to make your closing comments and
Yes, thank you, Chair and committee members. This is a program that works. We know it works, and we know that keeping people in their home and using other resources and supports until they need more supports is smart and a good use of dollars. So I request to move House File 1851 to the Human Services Finance Committee.
Representative Hicks renews her motion to refer House File 1851 as amended to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Opposed, say nay. Motion carries, and House File 1851 is, as amended, is re-referred to the Human Services Finance Committee. Our next bill on the agenda tonight is House File 2234 from Representative Edelson. Representative Edelson, if you'd like to come down to the testifier table. And if you'd like to move your bill, please.
Thank you, Mr. Chair. It looks like there's a lost bag at the sergeant's office. Sorry, I'm tired. It's been a long day. Okay.
That's all right.
Mr. Chair, I would like to move House File 2234 before the committee.
Okay, Representative Edelson moves House File 2234 to be referred to Judiciary, Finance, and Civil Law. I understand you have an A1 Authors Amendment. Would you like to move your A1 Authors Amendment and explain it?
Yes, thank you, Mr. Chair. Your CA is wondering why he gave me that piece of paper on where to send the bill. The A1 deletes the proposed new language related to documentation requiring guest speakers for substance use disorders. We want to simplify, not add more providers. It removes the expiration date for the Cultural and Ethnic Communities Leadership Council, which advises DHS on reducing disparities in DHS programs, and it makes technical clarifications. Let's see. Oh, but the A1 amendment does a lot. This is a DHS policy bill that makes changes related to. Nope. You know what? That's it for the A1. That's it.
Okay.
That's all I got.
It's been a long day, Representative
It's been a long
Edelson.
day.
I understand that. So Representative Edelson had moved the A1 Authors Amendment. Are there any questions for her? Not seeing any. All in favor of the Authors A1 Amendment signify by saying aye. Aye. Opposed? Motion carries and the A1 amendment is adopted. Representative Edelson, to your bill as amended.
Thank you, Mr. Chair and members. This is now a DHS policy bill that makes changes related to disability and substance use disorder services. This bill received an informational hearing earlier in session where we explained each provision section by section. So for today's hearing, we'll provide a high-level overview and respond to any questions. Director Grom is here, and I'll pass it to her, Mr. Chair.
Welcome to the committee, Director Grom. If you'd like to go ahead and start your testimony, please.
Thank you, Mr. Chair, and thank you, Representative Edelson. I know it has been a long day for all of us, so I can relate. For the record, my name is Christy Grom, and I'm with the Department of Human Services. So as Representative Edelson mentioned, we had a pretty extensive hearing a few weeks back on this bill. So hopefully members have had some time with the bill. We answered questions and went through it in detail then. So for today, I'm just going to kind of go over the I think we've got 7 or so main topics in the bill. I'll do an overview of those, and then we can open it up for discussion if that's okay with you, Mr. Chair. So the first thing to know about this bill is there are a variety of technical and clarifications that don't make substantive changes. So just know that those are kind of scattered throughout the bill. We went through those at the last informational hearing. There's also a codification of an existing pilot program called the Home and Community-Based Services Culture of Safety Program, or pilot. And so this is a pilot that is looking at critical incidents that occur in the HCBS settings. So in settings where people, for example, 245D, group home settings, where there might be issues, for example, like medication errors or elopement, and really taking a look at those issues with a critical lens and a system-wide lens. So this isn't something that replaces our licensing or maltreatment investigations. This is something that really adds to those investigations to make sure that we're taking accountability as a system for how we contribute to some of those critical incidents. And that is a provision that will be traveling to judiciary following this committee, which will be very exciting. Third, this bill codifies some definitions related to direct and indirect financial interest that apply to disability service providers. So these are definitions that right now live in policy. They live in our HCBS federally approved waiver plans, but we do need to add those to statute to make sure we're really clear and that providers have the guidance that they need to really understand what it is to have a community residential setting and what it is where it's a provider-controlled situation and what it is then to be providing services in a person's own home. And so that's something that not only helps providers, but also really helps to make sure we're very clear with people on what setting you're in and what services you have access to. Fourth, we've got some clarifications related to the foster care moratorium exception that was implicated when assisted living licensure passed. So just making some clarifications to align with intent with the repeal of Chapter 144D, which was the Housing with Services chapter. Next, there are changes related to substance use disorder treatment. So we've got a provision in here that hopefully makes it easier for families to stay in treatment, making sure that their childcare hours when they're in treatment isn't limited. Right now, unless you're a licensed childcare facility, you can only provide under 3 hours of childcare a day in treatment, and that's not oftentimes enough for people who, depending on a person's assessed needs. So we want to make sure we've got that flexibility. We're also making some staffing flexibilities for SUD providers who are what we call freestanding room and board providers. And so what we've heard from them is that oftentimes when people who are attending treatment aren't in the housing setting, there isn't a need to have staff there. And so they wanted to make some flexibilities to allow for that to occur. They will have to have an emergency plan in case someone unexpectedly leaves treatment and is back at the home, but we wanted to make sure that they've got the workforce flexibilities that they need. And then second to last, I'm almost done with my list of items in this bill. We are removing the sunsets from several advisory councils, which are extremely important. They've been in existence for a long time. They're not going anywhere. We still need them. And it's one of those things that we come back almost every 2 years to say, could we extend the sunset? So instead, we are just asking to have those council sunsets removed. And then lastly, there are some effective date clarifications in this bill that were brought to us by the reviser, indicating that if we didn't amend session law, they were not able to update the notes that they keep related to federal approvals on their website. And so that is the kind of general contour of the bill. Happy to answer any questions.
Okay, very good. Thank you, Director Grom. Looking out, are there any questions or comments that anyone would like to make? Not seeing any hands go up. So at this point, is there anyone from the public that would like to testify on this bill? Not hearing any. Representative Edelson, would you like to make closing comments and renew your motion?
Thank you, members. I want to renew my motion for it to go to judiciary.
Right.
Thank you.
Representative Edelson renews her motion that House File 2234 as amended be re-referred to the Judiciary, Finance, and Civil Law Committee. All those in favor signify by saying aye. Aye. Opposed, nay.
Somebody else.
Motion carries, and House File 2234 as amended is referred to the Judiciary, Finance, and Civil Law Committee.
Okay.
Our next bill is also from Representative Edelson. This one is House File 1434. Representative Edelson, would you like to move your bill?
I have, yes, I would like to move my bill, and I'd like to move my bill, and I don't know where it's going, Chair.
Okay, it's going to be to the Human Services Finance Committee.
Thank you. Thank you. I'd like to move it there.
All right, Representative Edelson refers House File 1434 to the Human Services Finance Committee. I understand you have an author's amendment.
I do. I'm glad I can provide comic relief for everyone.
Okay.
My author's amendment puts the bill in the order and the shape I'd like it to be in. It ensures that we encompass all parental fees. So I ask members to support it, and I can talk about the larger bill.
So Representative Edelson moves the A1 amendment to House File 1434. Are there any questions on the A1 amendment? Hearing none, all in favor of the author's A1 amendment signify by saying aye. Aye. Opposed, say nay. Motion carries, and the A1 amendment is adopted. We are now on to House File 1434 as amended. Representative Edelson, if you'd like to go ahead and explain your bill, please.
Mr. Chair and members, I will do that. Okay, so I'm going to get serious because this is a serious topic. So, Mr. Chair and members, the bill before you today is House File 1434. It would help address one of the most significant barriers facing parents and children with disabilities in Minnesota by eliminating the parental fee for medical assistance, state plan services, and home community-based service waivers. The Tax Equity and Fiscal Responsibility Act, also known as TEFRA, allows parents to receive in-home supports and medical services for their children with disabilities through medical assistance, or MA, as a supplement to private insurance. Since the 1990s, families who access this option have been subject to a sliding fee scale that has drastically increased over time. Parents whose children access waivers must also pay a parental fee, often in the hundreds or even thousands of dollars. Many of the testifiers here today will talk about, some of them $75,000 a year. I'm gonna finish my little paragraph because my screen has frozen. In comic relief tonight, this is true. Because of the significant cost, many parents are driven deep into debt, maxing out credit cards and taking second mortgages on their homes. Others are foregoing critical services and supports their children need. With that, Mr. Chair, I would like to move to my testifiers.
Okay, thank you, Representative Edelson. The first testifier I have is Gia Suttermeister. If you'd like to come down, please, and start your testimony.
Come sit.
Welcome to the committee this evening.
Thank you.
You're welcome.
Good afternoon or good evening, Mr. Chair and members of the committee. My name is Gia Sutermeister, and I live in Ham Lake with my husband and 4 children. Our daughter, Annalise, was diagnosed with a rare terminal neurological disorder in 2013 when she was 18 months old. We were told she would likely never walk, never talk, and that we could expect her to pass before the age of 5. Well, I'm still sitting here, so she's almost 11 years old today. Children with her disorder typically require a feeding tube, have debilitating seizures, require continuous care, including care at night due to sleep disturbances. Her disease affects all aspects of our family's life, practical, emotional, and financial. At first, we chose not to access a lot of the available services through the county and state due to the overwhelming information, meetings, paperwork, and then, of course, the very high monthly MA TEFRA parental fee. As she got older and her needs continued to increase, primary insurance denied pretty much everything we needed for her, including medical formula, a wheelchair, a walker, leg braces, therapies, and genetic testing. Eventually, after receiving over $50,000 in medical bills, we had no other choice but to access MA medical assistance through MA TEFRA. My husband works as a research engineer, and I work in clinical research at Medtronic. We love our jobs, and we both have continued to work even though it does not really benefit us financially due to the steep MA TEFRA fee we must pay. While we're not working, we administer 4 medications multiple times a day, monitor for seizures, administer medical formula via syringe, transfer up and down stairs, and ensure our daughter is supervised at all times. And we do all of this while trying to meet the needs of our other 3 children. Currently, our monthly MA TEFRA fee is higher than our mortgage. In order to pay off old medical bills, which I mentioned before, and make the MA TEFRA payments feasible, we have stopped contributing to our children's 529 college savings accounts, and we've borrowed money from our parents. We have considered taking on additional work to help pay the fee, but the additional work would, of course, further increase our MA TEFRA fee, so we don't do that. Having a child with medical needs is stressful financially and emotionally. The extra burden that the MA TEFRA parental fee puts on families in this already challenging situation is really unfortunate. And I'm hopeful that you'll support this bill to eliminate the parental fee for working families. Thank you for your time.
Thank you so much for your testimony and sharing your experiences with us. Next, I have Greg Wisher. Good evening. Welcome to the committee. Please introduce yourself and start your testimony.
Good evening, Mr. Chair, members of the committee. My name is Greg Wisher from Roseville, Minnesota. I'm asking for your support for HF 1434 for the elimination of the parental fees for children with disabilities under the TEFRA option. My daughter Madison, she's 10 years old and was born with spina bifida. She's a happy, fun-loving little girl who is willing to try just about anything and loves to make everybody happy. Before she was born, we were given the news of the diagnosis, and it was heartbreaking. The prognosis of the doctors was oblique and hard to comprehend. They informed us of the procedures that she would endure within her first 24 hours of life, and the hospitalizations, extended NICU stays, and therapies, and lifelong issues that she would face. We knew all of this was going to be very expensive and could potentially bankrupt our family. Fortunately for us, we had decent private health care through our employer. However, that was still not enough, as they would deny the needed medical treatments, physical therapies, durable medical equipment that she so desperately needed to thrive. At that time, we were told while we were in the hospital about a program for people who made too much money to be on medical assistance. And that's when we were introduced to TEFRA. We were told about the parental fee at the time, that there would be a small sliding fee, but we're not told how much that was going to be until 9 months later when we were finally approved for the program. So once we were approved for the program, we were already 9 months to a year behind in our TEFRA fees. But because of TEFRA, we were able to get our daughter the needed physical therapies to help her walk, which the doctors initially told us would not happen. It's also allowed us access to a wheelchair for when times that walking is just too much for her. It's also allowed us access to other therapies that our private healthcare would not approve for her quality of life. Now come the parental fees. The fees are billed on a monthly basis to allow families an, quote, easy payment option to keep current on their fees. However, as I said before, it took us 9 months to a year to be approved for TEFRA. So at that time, we were already $5,000 in debt to the state of Minnesota. Trying to figure out how we would climb out of that, we continue to get further and further behind. We have been sent to revenue recapture due to the outstanding debt to the state of Minnesota. We've already been stressed about the multitude of doctor appointments and therapies in our first 6 months, and now add in the thousands of dollars in debt to help our child succeed. The stress of the fees is overwhelming at times and is a constant in the back of our minds. We as parents want what is best for our child and to ensure that she can live the best life possible. When it comes to our professional lives, if we are even considering a career move or a promotion, we always first have to take a step back and think about what the parental fees will do. My most recent promotion, I had to tell my new supervisor I need 48 hours to think about it so I could prepare next year's taxes to see what my parental fee would be before I could accept that position. I've asked many elected officials for verification of where these fees go since I could not find them within the DHS budget, at which point I was told that they go directly into the general fund and not to DHS. If that's the case, I really feel that these fees are a tax on disabled children and not a fee for services rendered. In addition to the fees, they're very inequitable. We had our second child and our fees went down a whole $50 a month. And as many of you know, raising a second child costs more than $50 per month. Now this brings me to my professional life. With the stress of getting our daughter set up on this program, I decided to do whatever I could do to help other families navigate the system. I left my job in corrections that I had for 12 years and moved to a program eligibility worker for a county in the state of Minnesota. I've since been promoted and now assist families navigating the programs and put on trainings about the TEFRA program. I work with families on a weekly basis who are struggling with the thought of adding a parental fee of hundreds to upwards of $2,500 to $3,000 a month so their child can receive the services. I talk about the great things that TEFRA can do, but in the back of my mind, I feel guilty because I am putting families in a constant circle of debt. Families are already struggling, and the added expenses is taxing on their well-being. When families find out about their parental fees, they are shocked at how much it will cost. I always talk them through the reconciliation period, but that's still a hard pill to swallow once they're on the hook for so much. I've also helped families who get bills for $50,000 to $70,000 to $100,000 a year because they forgot one piece of paper to the parental fee unit and are now billed for 100% of services rendered. If they can't afford to pay the fee, they're sent to revenue recapture. Income tax refunds are withheld, bank accounts garnished, wages garnished, and more. There's really no way for a family to get out of these parental fees. The fees are based on the prior year's earnings, so if a family cashes out a retirement account the year before their child was born to purchase a new home, their fee is included in that income, even though that income is not ongoing and not reflective of what they can afford in that current year. In reading policy related to the fees, they are so well written that there's no way a family can make an extra dime without being assessed a fee the next year. Ultimately, it is the family's decision, but they're in so much stress about the pending medical bills and the fee that they just want it to go away. Minnesota is only one of 5 states that assesses a fee for TEFRA. All of our neighboring states that touch us do not charge a fee for TEFRA. Prior to 1996, the average TEFRA parental fee in the state of Minnesota was $546 per year. Now families are paying that per month. It's about time we join the rest of the United States to put an end to these fees once and for all and become a leader in disability rights and advancement and help these children succeed. Thank you for your time.
Thank you, Mr. Wisher, for your testimony and sharing your experiences. Next, I have Kelly Casso. If you'd like to come forward. Good evening. Welcome to the committee. Please introduce yourself and start your testimony.
Chair Fisher and committee members, welcome. I'm Kelly Kozel. I live in Apple Valley, Minnesota. I'm just going to touch on about the last 15 months of my life and how it affects the TEFRA parental fee. In December of 2021, my cousin Jill, who lives in Anoka, Minnesota, she was already diagnosed with breast cancer. She was diagnosed with bone cancer. And I was the only family member in the state of Minnesota that could actually help her. So besides working my part-time job in a school kitchen and my husband and me helping with our son Noah, I had to be her driver. I had to be there when the medical transportation wouldn't show up. And so basically the last 15 months of her life as she transitioned from home to ERs, to TCUs, to, doctor's appointments, I was there. I was there for it all. Sometimes I would have to travel in traffic like 2 hours each way. So I was busy taking care of my cousin Jill. And she passed away July 7th, 2022. Then during this time as well, I have a dear friend, Tracy. She waited to get medical services for her stomach cancer. She wanted to make that last TEFRA payment. And once she made that last TEFRA payment, she went to the doctor, and she was diagnosed with a rare form of stomach cancer and died 6 weeks later. And so I was helping with her 18-year-old daughter the whole summer after losing her mom. So come September, I got a notification saying the Minnesota Department of Human Services, like a recapture, not recapture, sorry. You either need to pay up or we're going to start garnishing your wages. In which I called DHS and I just said, I have been really busy. I have been saving the state money by caretaking for my cousin, who was also on MA. I just literally did not have time to deal with it because I had a really hard summer. I got my fees paid off, and I'm slowly working on 2 years worth of fees. I believe my fee last year was $950 a month, but I have to pay more than that right now because I'm behind, and it's just hard. We have two Honda cars, a Honda Civic 2005 with 296,000, and I have a Honda Odyssey, has almost 300,000 on it. My transmission went out 4 years ago or 5 years ago, and my parents had to borrow me the money so I could pay $200 a month for some years to get a new transmission. I don't want to get a new car. And then last, I will say, I work in a school kitchen. I work in an elementary school kitchen. I shouldn't be working. My TEFRA fee goes up because I work. I have a manager's license for the School Nutrition Association. I went through all the training. We are really considering me quitting my job after doing this year's taxes to see if it is even right or just. But what I can say is schools are struggling with finding people to work in their kitchens and paraprofessionals. And so if it makes no sense for me to work, which I completely disagree because I want to work, I may just have to walk away from my school district, and I don't want to have to do that because these kids depend on me and my kitchen staff. We have sacrificed, we have maxed out credit cards. Month to month, last month I didn't pay my Kohl's bill. This month I'm not going to pay a credit card bill because we can't afford it. It's really hard. And that's pretty much what I want to say for my story for the last 15 months. Many of you guys know who I am. And lastly, I just want to say thank you for all the past years and all the co-authors and authors who have authored this bill, because it's really important to my family, but it's also really important to many families, rural, Twin Cities around the state. Thank you.
Welcome. Thank you so much. Next, I have Josh Navarrete. If you'd like to come down, please. Welcome to the committee this evening. Please introduce yourself and start your testimony.
Thank you, Mr. Chairman and committee. My name is Joshua Navarrete. I'm from Andover, Minnesota, House District 35B. I'm a father of a 4-year-old son, Oliver. He's a beautiful, rambunctious, kind, sweet little boy who happens to have Down syndrome. I'm also a high school special education teacher at the North Education Center in New Hope, District 287. I'm here today to ask you to support House File 1434 that will eliminate TEFRA fees on families with children who have disabilities. This fee, or what I call rather a tax, is a major burden to my family and many others in our great state. Our monthly fee is around $600 a month, or about $7,200 a year. I also pay another $290 a month for my private health care insurance through my employer, which equals $2,600 a year. We have a $4,000 deductible. And as you can imagine, as a public school teacher, that's a lot of money for my family. The money we pay into TEFRA could be used instead to help support my son and his needs. Oliver was born on November 25th, 2018 at the Masonic Children's Hospital in Minneapolis. This is because he was born with a congenital heart defect that required him to have an open heart surgery through a full bypass to repair his heart. He was also born there and was required to be in the neonatal intensive care unit for 21 days. So at 4 months, he had his heart surgery. We also had another surgery where he was, one, to fix a hernia that his liver went through, passed up to his heart. They needed to correct that. He's had various ear surgeries over the years to correct his hearing. Oliver receives, through TEFRA, a lot of great services: speech therapy, occupational therapy, feeding therapy, as well as physical therapies to help him, fulfill his potential. Without TEFRA, we more than likely would not be able to access many of these services because, as you know, private employers like to deny services because this is not cheap, as you can all imagine. The one thing we're worried about is this year, my wife and I started a small business, a sole proprietorship, and it's been pretty successful so far, which is amazing. We're very concerned about next year because, as the previous commenters have said, they base it on your previous year's income, and as a brand new business, we cannot expect the following year to be as good as this year. But as you know, TEFRA does not care about that. So we're very concerned about the increase in fees that could possibly make it to where we may not be able to use the TEFRA services if these fees continue. The TEFRA fee is essentially a penalty on families that have kids with special needs who need services but make too much money to get the regular medical assistance. Minnesota families and their kids should get services they need regardless of income level. As a special education teacher for around 14 years, I can attest firsthand and have read many studies that prove that early interventions are essential to ensuring that these kids can find their full potential and become productive members of our communities. In fact, according to the CDC, early interventions can have a significant impact on a child's ability to learn new skills and overcome challenges, increase success in school and life. Thus, my son and other children with a disability need access to these early interventions through the services provided by TEFRA. Because this fee can get quite large or take up a lot of families' take-home income, many families across the state forego this service because they have to choose between paying the TEFRA fee or putting food on their table, which isn't something that any Minnesota family should have to choose between. And I just hope that my family doesn't have to choose between getting Oliver the services he needs and putting food on our table. TEFRA is essentially double taxation on families with kids who have a disability. My family, as well all other families on TEFRA, already pay federal, state income taxes, payroll taxes, sales taxes, and all these other taxes that go into this. And then on top of it, we are required to pay a TEFRA tax. It's unfortunate. I humbly ask you guys to support HF 1434 and eliminate TEFRA fees so that families can focus on their children and our kids can get the services they need and they deserve to realize their full potential. I just want to thank this committee for their time and for giving me the opportunity to speak on behalf of my son Oliver and my fellow Minnesotans who have children with special needs. And I just want to thank the committee for their time and letting me speak.
You're welcome, and thank you for taking your time to come down and talk to us today and present your experiences and what you've gone through with your family. Thank you.
Thank you, sir.
Next, we have Maren Christensen Hoffer. Good evening. Welcome to the committee. Please introduce yourself.
Thank you so much, Mr. Chair. My name is Maren Christensen Hofer, and I am a parent of a child with a disability. I'm also a former participant in the TEFRA program, and I'm also the executive director for a nonprofit organization called the Multicultural Autism Action Network, which helps families navigate services and supports for their kids. And I don't think I can add anything more to the parent testimony that you've already heard. I think they have made it perfectly clear, what this means to families and the incredible strain and stress. We've heard about families that have taken out second mortgages and turned down promotions. And I know of a family that turned down an inheritance because of what it would do to their parental fee. So I think that's really clear. I will maybe just put my advocate hat on for a moment. To add that, most of the problems facing families of children with disabilities are really difficult to solve. They are systemic, they are generational, they deal with problems like ableism and stigma around disability. I mean, these are really tough problems to crack. This one is not. This is a really easy problem to solve. And we've heard from the history a little bit that these fees were introduced as a way to solve budget problems, and they've been increasing, incredibly since then. I personally don't think that was the right policy decision then, but I know it's not the right policy decision now. And so we have an opportunity to do something that will be tremendously impactful for these families and make an immediate difference in the quality of life for these kids and their families. So that's what we're asking you to do. Thank you so much.
You're welcome, and thank you for being here tonight. Is there anyone else from the public that would like to speak on House File 1434? Not seeing any. I do know we will go to member discussion. Representative Hicks, I have you as first.
Thank you, Chair. Thank you, Representative Edelson, for bringing this forward, and thank you to our testifiers. When we were talking not that long ago about the MAEPD bill, and we were talking about a tax on disability, I brought up this bill as well, because it's another example. I have been in the shoes of the parents that have testified today. I have paid those fees. I have tried to figure out how to do that. At one point, and nobody told me, so I wish I'd had a TEFRA parent as a financial worker. Nobody told me that when the next child was diagnosed with a disability that I could put her on TEFRA and how that would affect parental fee and all of those pieces. It is so difficult to be paying in our situation when it was us, $750 a month in a health insurance premium for our family, and then $350 a month in a TEFRA payment. We were a little bit more poor, so it was a little bit smaller. But when you put it together, it was $1,000 a month. Our mortgage at the time was $900. And it was, does Hudson get the early intervention services he needs, or do we pay the mortgage? And he's 11. It is absolute, or at least 12. Oops. It is absolutely time that we stop punishing people with disabilities for existing and needing supports and services to do so.
Thank you, Representative Hicks. Are there any other comments or, oh, I'm sorry, Representative Baker, go ahead, and then Representative Keel.
Again, Mr. Chair and Representative Edelson, I'm sitting here with a little bit of a dumb look on my face because I'm a little embarrassed. I haven't heard more about this before. It's not my first time with HHS, but I've never heard this kind of dire stories tonight, and I'm a bit shocked and a little bit stunned that we don't have a little better gauge or a maximum or something to allow families to take in these children and their disability loved ones that we are so grateful they're here and they're so special. And I've never known this incredible burden to be so outrageous to put families at such difficult decisions. And I guess I didn't know this. So could you or somebody, and maybe it's DHS, I don't know. I mean, I'd like to know what kind of revenue does this generate to the state and where does it go? I heard it goes back to the general fund, but obviously there's a fiscal note to this, and it's not here, right? I assume it'll go to another committee. I'm just a little bit shocked and embarrassed, I guess, because I don't know this. And we have to figure out something, but I want to know, has it been getting much, much worse in the last couple of years? Has there been some kind of a major change that it hasn't blown up earlier? So can you give us a little bit of that background, please?
Representative Edelson, if you'd like to go ahead.
Thank you, Mr. Chair, and thank you, Representative Baker. All good questions, right? It's sometimes in these committees we hear about it for the first time, and it's shocking. So in 2019, the program they paid in. There was all the families paid in 11 million is what I have. That was an estimate, and there's about 10,000 families in 2019 that were participants in this. I know that we do have DHS Ann Bobst here, so I don't know if she has any more to add. There she goes.
I see we're phoning a friend. I see Ms. Box on the way down. Good evening. Welcome to the committee. Please introduce yourself, and if you can answer the question on dollars, that'll be very helpful.
Thank you, Mr. Chair, members. My name is Ann Bops, and I'm with the Department of Human Services. Representative Baker, to your question, unfortunately, I don't have a more updated number off the top of my head from Representative Ellison, but I'm more than happy to look into that and report back to the committee.
Representative Baker.
Mr. Chair, is this something that's driven by the federal? Is this a federal requirement? Is the state in complete control of this TEFRA fund? The Tax Equity and Fiscal Responsibility Act, it sounds federal to me. So is the state bound by this? And I want to understand, I could not have afforded anything close to what these folks are doing. And I would have just quit making the payments, and then what? And then what happens? Because I want to know, they shouldn't quit their jobs. We don't want them to quit. We want them to be able to take care of their children. What happens then?
Ms. Bobs.
Thank you, Mr. Chair. Representative Baker, the TEFRA program is a federal program. As you can see from this bill, we have some control in state statute on what the parental fees are. There are provisions in place in the program if a parent doesn't pay. There are collection procedures that do then get followed that I believe are also in statute and rule. But I hope that answers.
Well,
Baker.
Mr. Chair, thank you. And again, it's almost forcing folks to file bankruptcy. It's almost to that point. I don't know how you would do it otherwise so that they can protect their assets and something. I don't know. And I'm not going to belabor it. It is an embarrassing situation for us at the state level. And I'm hoping, and I'm glad, Representative Edelson, you'll be a champion on this. And I'm happy to help and work on this. I don't understand how it could have gotten this bad without us maybe seeing this. And again, I'm not saying this is the first time it's come up. It's the first time I've heard about it. And I hope that we can do some serious fixing of this. And to just wipe it away, I don't know if other states have done that or if there's other pathways to this, but I'm looking forward to hearing a lot more and trying to certainly make a correction of this monumental effect on families. I just can't believe it. So anyway, thank you for bringing it to us, and thank you again to the testifiers. I guess I just didn't know. Thank you.
Thank you, Representative Baker. Representative Keel.
Well, I'll continue I'm shocked, and maybe DHS wants to hang around for just a minute, because I got a feeling I'm going to ask the question. Someone mentioned somewhere along in this testimony that other states do things differently. Do we know what other states do with this TEFRA fund?
I'm seeing heads bobbing up and down. Who would like to?
So
Ms. Christensen Hoffer.
Yes, my name is Maren Christensen Hofer, for the record. And this issue of the TEFRA fees has been around for a long time, and there's a group of very passionate advocates that have been working on reducing the fees and asking for elimination for quite some time. And as a result of some of that work, we have looked at what's going on in other states, and there are a number of different ways that this is implemented in different states. Some have no parental fees at all. Some don't make this option available. If your family does not qualify for medical assistance based on the income requirements, then it really isn't an option. But as we heard, it's really important that families do have access, because there are so many things that aren't covered by private insurance. There are other states that really restrict the number of people that can get access to the program. So it's a lot of different variation in the way that states implement it. Does that answer the question?
Representative Keel.
Thank you, Mr. Chair. It kind of. I feel a little dumbfounded too, because it just doesn't seem like something we've talked a whole lot about. It's a little bit shocking to hear. And I guess I'm wondering if this is putting families in financial straits, why is it necessary to pay the fee? Or can there be just some minor fee? Especially if it's going into the general fund, that also kind of makes me wonder where the money should even be going. I have a lot of questions. I just don't even know if I can understand all this. I'm dumbfounded. I know, I'm the lead. What the heck? No, it just is really surprising. And yeah.
I'll go to Representative Hicks.
I'm about to bite at the bit.
Yeah.
So I am a TEFRA. I was a TEFRA parent. We aren't on TEFRA because the parental fee is ridiculous. To be clear, Wisconsin, North Dakota, Iowa, and South Dakota do not charge parental fees. This bill makes us like them. It gets rid of the parental fee. No one around us charges parental fees. I have sat on the phone and counseled parents of children with autism who moved here from Wisconsin because they got a job, they got a whatever, right? And I have listened to them. There was one mother in particular that was just very painful for me to talk to. Moved to Rochester, right? Got a job. And I run some autism groups as a mom in our community. And somebody gave her my cell phone number and she called me. And I listened to her cry on the phone because her husband's job did not cover the intervention her child needed. And because of the work that he did and the fact that he gets bonuses because he's in retail, to access the intervention, their parental fee was $3,500 a month. And she sobbed at support group and said, how do I choose between my other kids and this child? How do I decide how do I pick? And I had to say to her, you go on TEFRA and then we figure it out. They'll take your taxes, they'll put you in collections, but they won't end his services and he'll get what he needs. And then you can look at your finances and figure out how you adjust your income to make this work. That was an actual conversation that I had with a parent who moved to our community for employment and didn't understand that in Wisconsin, their child could get what they needed, and in Minnesota, they couldn't.
Thank you,
Sorry,
Representative
I'm
Hicks.
really, really passionate about this area.
No, and thank you, Representative Hicks. You know this inside and out and can help provide some of the insight on this. You know, this is something that we put into statute. And when I say collectively we, this is what was done by the legislature years and years ago. And so the only way to change it is it's going to take us to be able to do that. And so I know this is going to be one of the things that we're going to continue to be talking on. I'll go back because I know Representative Keel, I've got Representative Backer, and then Representative Noor, who's Chair Noor, where this committee is, where this will end up, also wants to talk yet. So anything else, Representative Keel?
Thank you, Mr. Chair. I just would like to know kind of the fiscal part of this. And I don't sit on finance, but I'm kind of interested in how this works, why we actually decided to do this and other states did not, and how they manage it. So there's other ways to look into some of this, so I'll spend some time doing that too. But does this stay in the Human Services Finance issue?
Yeah,
So-
Chair Noor, this is going to end up in Chair Noor's committee.
Okay.
Yeah,
Great.
it's solely in this area. It doesn't go anywhere else.
It won't go to health, so, great. Thank you.
Yes. All right, next we're to Representative Backer.
You can call me Baker. No, I'm Chair.
Oh, no, I was going to get confused there.
You know, you can. It's not been the first. It won't be the last. So anyways, on the serious note, do we have and as others have said, this is actually appalling what we've heard tonight. My question is, and this may be a full enough friend scenario, how many families are put through this type of scenario in Minnesota? Are we talking about hundreds? Are we talking about thousands? Do we have an idea what that would be?
Representative Edelson, and then from there we'll bounce to whoever else if we need some additional information.
Mr. Chair, Representative Backer, first of all, Representative Backer, thank you for being a co-author. I appreciate you. We have an estimate of 10,000 families from 2019, but DHS might have more clear numbers. And I just want to also just highlight with that question too, it's not an easy program just to get into. It's rather challenging. And then also you have to qualify and their state medical review team that really qualifies you. So, but I don't know, do you guys have any other? So DHS will follow up with official numbers, Representative.
Mr. Chair and Representative Ellison, I would appreciate that. Yeah, it would be nice to know that because this is something that we have to address. So thank you.
And I apologize for missing out. Ms. Punelli found a little information here, if you'd like to go ahead. This has been a problem that we've been trying to address, and if you could let everybody know what's been happening over the last couple of years on that, that would be helpful, I think.
Mr. Chair, members, this is an issue that's been around for several years. I was just trying to remind myself of when the last time we changed this statute was. It was in 2019. The fee schedule was modified to slightly reduce the fees. I think that has happened a couple of times over the years. So
3 times? Okay.
So it has been worked on and kind of chipped away at.
Thank you, Ms. Punelli. Appreciate that. Then I'll go over to, and thank you everyone for the flexibility here. Appreciate that. Chair Noor.
Thank you, Mr. Chair. Thank you so much, Representative Edelson, for bringing this bill forward. That's something that I've worked on in the previous session. Representative Becker, I think if you, in Human Services in 2019, Senator Mann carried the bill, and we took a small bite of the apple because we could not swallow the fiscal note. The income guidelines, if you are below 275%, you don't pay the parental fee, if I'm correct. But if you're above that, you pay the parental fee. The number that I got last time was about 4,000 and some who paid the parental fee, and it's upwards of more than $23 million. That's the cost. That has been the issue, ongoing cost of more than $23 million. And that's something I think we can figure out how we handle the cost to this issue, because it's always about how do we prioritize what we're going to do for those of us who are in the human services finance? But that's how the program was designed originally to work. And I think we will still have more conversation, and looking forward to this bill coming to finance. Thank you, Mr. Chair.
Thank you, Chair Noor. And then Representative Engen.
Thank you, Mr. Chair, and thank you, Representative Edelson, for bringing this forward. This is egregious, and it's happening under our nose. I'm just curious, when did this start? I mean, I've heard 2019, I've heard 11 million, I've heard 10,000 families. There's just a lot of numbers being thrown out, and I guess I'm just curious, when did this begin?
Representative Edelson.
Mr. Chair, Representative Engen, I believe it was in the 90s, but maybe House Research has like a final. No, okay. Well, it was, hold on, I have a testifier. She has some information, Ms. Castle.
Ms. Castle, welcome back to the table.
Thank you, Chair Fisher and committee members. This is Kelly Kozel again. I believe 2003, it was under Tim Pawlenty's administration. The ARC did something, I believe, in 2019 that talks about it, but it was a way of getting money for the state when the state was in like the negative. That's what the history I have. Prior to that, I think the max maybe was like 575 for all year.
Okay, thank you.
Chair Fisher, I'm sorry, but I believe, I mean, I've talked to you about it over the years, and I know many of you guys are co-authors for the bill, so I just thank you for giving it time.
Thank you for a little bit of the history there. Appreciate it. Representative Engen.
No, just thank you. I really appreciate you bringing this forward again, and it sounds like we're all a little bit dumbfounded, so hopefully we can get this addressed and make sure that we're looking out for other things that might be right underneath our nose, but we've just missed. Make sure that we don't impose extra costs or liabilities on these families.
All right, thank you. With that, I will go back to the author. Would you like to make any closing comments and renew your motion?
Thank you, Mr. Chair. Just some of the kids, the families that they're advocating for tonight are Oliver, Simon, Noah, Annalise, Madison, Lewis, and there's thousands of other kids that are impacted, and parents are making impossible choices right now. So for my colleagues on the other side of the aisle, I would love you guys to sign on and help me with this as well. And this can be a bipartisan area. And so just ask for your support. Thank you.
Thank you, Representative Edelson. Representative Edelson renews her motion to have House File 1434 as amended re-referred to the Human Services Finance Committee. All in favor signify by saying aye.
Aye.
Opposed, say nay. Motion carries, and House File 1434 as amended is being re-referred to the Human Services Finance Committee. Next, we have House File 2215 from Chair Noor. Chair Noor, if you'd like to have a seat and move your bill and introduce it.
Thank you, Mr. Chair and members. I'd like to move House File 2215 to Human Services Finance Committee, Mr. Chair.
Okay, Chair Noor moves to have House File 2215 referred to the Human Services Finance Committee. Go ahead and introduce your bill, sir.
Thank you, Mr. Chair and members. Just wanted to note up front that there'll be some changes to the language that we are discussing about 2215. But I wanted to take us back a little bit in terms of the historical perspective of why we have this bill. When we had housing with services, and then we transitioned folks to the assisted living licensure. It happened to be that we moved all those small settings, which are providing services to less than 4, to a new setting which was under the assisted living licensure. We came back and put a moratorium on any assisted living that has got less than 4 residents so that we don't have ongoing. It happened to be that some of these settings, they have individuals who are under the age of 55, which if you want to start right now under the assisted living licensure, you have to be 55 and above. So what that created is the grandfathering in of the assisted living to from housing with services to the assisted living licensure created a little bit of a hiccup in that process, where we now have put a moratorium so that we don't have a small settings, and then they're taking care of individuals who are under the age of 55 receiving CADI waiver and BI waiver. So what that essentially created is, are they in the right setting? Or are those individuals that we're serving them in the right setting? So some of the plan that we came up with is to move some of those individuals into the corporate foster care or the CRS, community residential settings. That was, we opened up the moratorium so that we can allow them to move. But we did put some conditions there, which are heavy to meet for some of the small groups. Number one, they have to be licensed as 245D. And as we all know, there's a long delay. And the time for them to complete the process in order to apply for those small settings who want to move to the community residential settings, it has to be done by June of this year. And I can tell you right now, many of them are struggling because they don't have that 245D. The options that we're trying to come up with is, if you're in a smaller settings, particularly for those who are BIPOC communities and those who cannot afford to buy a home, and guess what? If you have the assisted living licensure, you lose the place that you are providing care. You're not going to move. You're not going to move with that license. It's gone. I know we've seen incidents that have happened recently, but I think it's worth taking time to understand where should an individual with needs be put in and which settings. And then removing some of those barriers, because we know we do have workforce shortages. We know we're trying to move people from the hospitals as part of the hospital decompression. We have smaller settings that are able to take care of those who are in need, but we've put some barriers after barriers. So we want to make sure we remove those barriers and to be able to transition to the appropriate setting and to be able to continue to provide that services without worrying many struggles in terms of moving to assisted living, to group homes and different settings that are created within the system. Mr. Chair and members, I just wanted you to hear from those individuals who moved from one place to the other so that we can figure out the appropriate way of assisting those individuals in order to continue to provide the services that they're providing today.
Thank you, Chair Noor. And the first one I have is Zania Harat. If you'd like to come down, please. Good evening and welcome to the committee. Thank you for being here.
Good evening.
Please introduce yourself.
Good evening, Mr. Chair. Just to make sure there's no confusion, I'm not Zania.
Oh.
I'm Amal Ahmed.
Oh.
Zania is also here with me, but she'll come after.
Okay.
So we just had to move things around just a little bit.
Okay, sure. Go ahead,
Okay,
Ms.
so-
Ahmed.
Yeah, so good evening, Mr. Chair and members. My name is Amal Ahmed. I'm a registered nurse and one of the executive board members of Residential Providers Association of Minnesota, or RPAMN. I'm here today with my colleagues Zania Harut and Romanda Gay, right over there. RPAMN is a 501c6 nonprofit trade association that represents small residential customized living and waiver service providers in Minnesota. We were formed in 2021 following a series of massive changes to the regulatory and reimbursement landscape in which our members operated. RPAMN has roughly 200 provider members and subscribers, with the vast majority being BIPOC-owned, culturally specific service providers who might not otherwise be engaged in the policy development and legislative processes. We are here today to testify in support of House File 2215 and provide some historical context and firsthand experience for the committee to consider as you all work together in this legislative session. So to start with some context, as you all may know, in 2019, Minnesota was facing a historic budget deficit, and in an effort to control medical assistance costs and encourage people to receive services in their own home, the legislature authorized a moratorium on the growth of licensed community residential settings, or CRS beds, and directed DHS to reduce the number of beds in services. Unfortunately, not only did the moratorium freeze the number of licensed CRS beds, but it also froze the demographics of those providing these services. According to the Minnesota State demographer, in the decade that followed the establishment of the moratorium, the state has added 5 times as many people of color and non-Hispanic white residents. Between 2010 and 2018, the fastest growing racial group in Minnesota was Black or African American population, which grew by 36%, adding more than 96,500 people. The second fastest was the Asian population, which grew by 32%, adding 69,800 people, followed by the Hispanic population, which grew by 24%, adding 59,000 people. These demographic changes fundamentally changed the profile of the individuals with disabilities needing CRS or other residential services, but unfortunately, culturally specific BIPOC-owned providers were generally boxed out of the conventional service delivery model. However, providers were innovative and began serving members in their community in single residential family settings. These settings were registered with Housing with Services facilities with MDH via comprehensive home care license. These services were then reimbursed as customized living for individuals under the CADI and the BI waivers. The regulatory model used by the BIPOC service providers was also the regulatory model that was used for the larger residential providers that were generally thought of as assisted living facilities. These providers were generally serving older Minnesotans in large apartment-style settings, where the settings that the legislature and MDH sought to regulate as it developed the chapter of 144G, assisted living license law in 2019. So I don't believe that the legislator ever intended to include single-family residential settings in its definition of assisted living. In fact, the definition of assisted living facility in section 144G.08 expressly exempts a service residential settings license under Chapter 245A, including adult foster care services and settings governed under the standards in Chapter 245D. So I believe that the legislator recognizes this regulatory disconnect, at least in part, when it created a temporary exception for the CRS licensing moratorium in 2021, that it was explained to us was supposed to allow a large number of BIPOC-owned culturally specific providers to transition out of the MDH customized living world and into the DHS DWRS system. However, in 2021, the legislator simultaneously decided to expressly exclude customized living providers serving individuals with disabilities on the CADI and BI waivers from the board swath of medical assistance rate, increases made possible by Congress' temporary increase in the federal Medicaid assistance percentage, the FMAP. Whether this was to control costs in the program or incentivize providers to transition, I don't know, but it had a disproportionate impact on BIPOC-owned customized living providers seeking to provide culturally specific residential services to members of their own community. So being excluded from the 2021 rate increases was particularly detrimental to RPAMN's members, as we were not only struggling to respond to COVID-19, but we were also in the process of becoming licensed as assisted living providers, working to meet the series of regulatory requirements never intended for the single-family settings where most of them serve their clients. Today, like other long-term care and home community-based service providers, we are struggling to find staff to address the rising costs of living, but we are doing it without the hundreds of millions of federal dollars invested in the system 2 years ago. On top of that, we continue to wrestle with the assisted living licensing requirements that were never intended for us while we work to navigate a moratorium exception process that is simply broken. As introduced, House File 2215 seeks to do two things. First, it seeks to change the moratorium transition process to remove significant barriers that stand in the way of our culturally specific service providers successfully enrolling in the program. For example, as you heard, DHS, when they presented their budget request, the licensing division is completely overwhelmed, and it is taking nearly a year for a provider to secure a 245D license needed to make the CRS transition. Further, because the existing exemption is tied to the individuals receiving services and where they were residing as of July 1st, 2022, the licensing delays have resulted in providers either being unable to take new residents for fear of losing their eligibility or making the transition with a reduced capacity that puts their economic viability at risk. Second, House File 2215 would provide a temporary 2-year rate increase for customized living providers serving individuals on the CADI and BI waiver in line with that is being proposed for the EW program. While we understand the desire to reduce the cost of the program, the human impact on our BIPOC-owned service providers and the members of their communities they serve during this moratorium exception process cannot be underestimated or understated. In summary, RPAMN is here today representing hundreds of BIPOC-owned culturally specific disability service providers who are struggling to comply with the requirements of an assisted living license that was never intended to apply to us, while trying to navigate broken licensing enrollment and processes to transition into CRS via the moratorium exception, with all the while being the one collection of service providers who were expressly excluded from the last biennium's rate increase. We believe that House File 2215 is a starting point as we work with you all to find a resolution to this program during the 2023 legislative session. Absent significant legislative action, RPAMN's members will continue to fail, leaving thousands of Minnesotans of color without the ability to receive support from providers in their own communities. Thank you, Mr. Chair and members.
Thank you for your testimony.
Yeah.
And then next would then be Zina Harat then?
Zania.
Zania, thank you. Hi, good evening. Welcome to the committee. Please
Hi.
introduce yourself and start your testimony.
Good evening, Mr. Chair and members. My name is Zania Harut, and I am a registered nurse and the owner of Affinity Residential Care. I wanted to start off by saying that for the 21st year in a row, nursing was ranked as the most trusted profession in the United States. As a proud registered nurse here with other registered nurses here that provide home and community-based services, I'm here to advocate on behalf of Minnesotans with disabilities. I'm here also as the board chair of the Residential Providers Association of Minnesota, also known as RPAMN. We represent over 200 primarily black and brown providers of customized living. And again, I'm here with several other dedicated and qualified registered nurses who work tirelessly to advocate for indispensable publicly funded services for Minnesotans with disabilities. Supporting this bill would allow providers to keep their doors open for the residents that desperately need the care and services. As members of this committee know, every home and community-based services provider operates within a fast-paced regulatory environment involving state, local, and federal government. The system is complex and has many moving parts, but at the end of the day, what we nurses and providers care most about is ensuring that our clients are supported to live a meaningful life while receiving the care and services that they need. When changes that impact millions of people are taking place in Washington or even at the state level, it's inevitable that issues will arise and that gaps in access will come about. In the year 2023, it should not surprise us to observe that the human services regulatory machine, like so many other systems of power, is not prioritizing the unique needs of our BIPOC communities. Truthfully, no system of this size created and run by human beings will ever be perfect. But thankfully, in our democratic system, we the providers who know our clients so well have the power to organize and express our voices. When we can no longer solve the issues facing our clients in our practices on a case-by-case basis, we must call upon our elected representatives to intervene, and that's why we're here today. Black and brown providers serving clients in small settings have faced enormous challenges in the recent years, stemming from overwhelming and expensive regulatory changes to customized living. Action taking place at all levels of the system, from CMS all the way down to the lead agencies and case managers, have made providing services under the customized living model almost impossible for small providers. We are constantly restructuring our budgets to maintain the highest quality of care, with many providers choosing to spend their own money and savings as their clients' services have been cut. The services were cut amidst the worst pandemic of our time. Many providers have faced cuts of as much as 70% and have been threatened that if they don't continue to provide the same services for a lesser cost, their licenses, their nursing licenses and facility licenses will be at risk. And the bottom line is we're providing the same care and services without proper reimbursement. While high quality care remains our #1 priority, we know that our clients feel this impact as well, and they are stuck with the uncertainty of not knowing where they will be living and receiving services 1 year from now or even a month from now. We've heard from many providers that have shut their doors. They've just collapsed. They were not able to sustain financially, and some of those clients ended up going into shelters or into hospitals. I must emphasize that we're facing a crisis. It's a well-documented fact that when society fails to serve people in the community, we see an increase in the number of disabled people forced into the streets, into hospitals, into jails, and into mental institutions. The hospitals are at capacity, nurses are burnt out, and the way the statute is written, in the way that the statute is written now, we are not able to receive new clients that so desperately need the care and services who are stuck in the hospitals. The reality feels really dark sometimes, and our provider community is still fighting for our clients because we know that this committee and its counterpart in the Senate and the public will not stand idle when faced with a human catastrophe. The issues I'm describing are complex and will not be completely solved by any action taken by this committee today. However, the language put forward by Representative Noor is an indispensable piece of the puzzle. By allowing our small Black and brown providers to transition smoothly to community residential services and allow a temporary rate increase to prevent collapse during this transition, we give them and their clients the opportunity to settle into a framework that, although not with its own flaws, is more predictable and stable than customized living. Thank you for listening.
You're welcome. Thank you for taking the time to be here this evening to talk to us. And then I have Ramonda Gay. Come on down. Good evening. Thank you for being here tonight. If you'd like to introduce yourself, please, and start your testimony.
Good evening. My name is Ramonda Gay. I'm a registered nurse and also a community residential provider. I'll try to get to the point here. We have 3 homes that we provide disability services to: mental health, both medical and mental health services. Our clients need 24-hour services. We have to hire based on the client needs. Due to the wage increase, we're not able to do that because of the cuts. And we have to ethically and morally continue to provide the same services. I'm here today to express what my colleagues are, their concerns, and also my concerns. We have been forced to continue to provide these services, but given no tools to do that. And when it's expressed, we're threatened with our license, are threatened that our doors will be closed. So during the 2021 transition, DHS decided to transition us under assisted living license, and whereby that's not where we belonged. We were supposed to go under foster care and community service residential area. For those of us that were already in business when that transition happened, we were given a moratorium to transition over to have a 245D. But again, the 245D, we apply for it, you can't get through, you can't because of the backlog. And now the county, I have called the county, and they're telling us that, well, we're supposed to fill out something and send it to DHS. And when that is done, that nobody in the county knows what's happening. So I am on the phone 24/7 talking to every county. We have a home in Anoka and St. Cloud. So we're dealing with Benton, Stearns, Sherburne, you name it. So we're trying to service. So then the social workers are telling us to apply for the rate exception. So I've done that, and then they still turn us down. So because without the rate exception, I have also referrals of people that are waiting to come into the home, but I can't provide services to them because we can't pay, due to the wage increase since COVID, you can't hire the right people to work, and people quit on you within no time. I tell most people I live between St. Cloud and Anoka because I'm constantly on a highway covering shift, calling in agency to cover, and which agency coverage is also extremely high. But because of the safety of the clients, we have to do all we can to be able to do that. So in short, I was told to keep it short. So in short, I'm here today pleading with DHS to give us what we need in order to provide services to the population that is unserved, which is the mental health and a disability community. We're willing to do what it takes to take care of the people that needs our services and our help, and we're compassionate about it because that's the field we went into. I'm also a psychiatric nurse as well. And so thank you for your time, and I hope you guys are able to help.
You're welcome. Thank you for being here this evening. Is there anyone else from the public that would like to testify on House File 2215? Not seeing anyone, we will now move to members for members' questions or comments. Are there any questions or comments from any members? Representative Keel.
Thank you. I wondered if the department would explain why the change happened, and I catch some of the discussion. Maybe Representative Chair Nor, you can explain it, but I'm wondering what happened here. After listening to this conversation, I had somebody just call that does PCA services, home and community, home-based services, and this sounds strangely familiar that they're having trouble getting help. And it's putting them in a very hard place to even be able to provide services. So I'm just wondering if somebody can explain that.
I see the department slowly working its way down. I'll go to Chair Nor first, and then we can go to Director Grom.
Director Grum can do a better job than I, so.
All right. Welcome, Director.
I think you can remember the 144G when we passed the assisted living licensure, which we moved people, transitioned them from home, I'll let Director Grum go. Go ahead.
Director Grom.
Mr. Chair, members, Representative Christy Graham with the Department of Human Services. So I think Chair Nor is correct that there was a confluence of two different regulatory actions that were happening at the same time related to assisted living licensure and then related to these small settings that were providing customized living, which is essentially assisted living, to CADI and BI populations. And I think at the time, what the legislature had pointed out, in particular in the other body, was advancing legislation to address this and having conversations about this back in 2020 around some of those small single-family home settings appeared to look like and operate similar to and serve the same population as group homes did or community residential settings did. So there was many conversations at the legislature and in the governor's budget to kind of say, well, let's take a look at these settings and let's make sure that they are licensed as they are operating, so licensed as a community residential setting. So we created that moratorium on those single-family homes at that time for that reason, and then also created the exception to the community residential, to the corporate foster care moratorium, so that they would be able to get licensed that way. We have been in conversations with stakeholders for quite a while, and we do recognize that there were potentially some unintended consequences. We certainly don't want to reduce people's access to culturally responsive and culturally specific services. That's by no means what we want to do, and we're so appreciative that stakeholders have come forward to share with us their experience, and hopefully we can work together on some solutions. We do have, in addition to Chair Noor's bill, which we're working with him on and the stakeholders on and providing technical assistance, we've got an investment in the governor's budget as well to support these small customized living providers who are transitioning to whether it's community residential services or integrated community supports, whatever service model might meet their needs and the needs of the populations that they're serving.
Thank you. Representative Keel.
Thank you, Mr. Chair. My brain is racking. I'm trying to think about what the constituent told me, but this sounds strangely familiar, and some of it is different culture services, but some is not of what my constituent actually provides services for. And she herself is a quadriplegic, so she provides services and more home settings, but I think there's group settings within the, probably in the Red Lake Nation is where she's working. So, thank you. Thank you.
Thank you, Representative Keel. Looking around, not seeing any other comments or questions. Chair Noor, would you like to offer closing comments and renew your motion?
Thank you, Mr. Chair and members. I think you have listened intently on this issue. It has been an ongoing discussion since we instituted the assisted living licensure, meaning that those small group homes that we move them to become an assisted living, which they don't fit. It's not only one group or the other, it's across the state, mostly in the metro area, but we also have few individuals in the greater Minnesota. So this opens up an opportunity where they can move to CRS, community residential setting. Most of them received a letter in terms of what they need to do, but we need to remove the complexity in terms of that transition. Appreciate that the governor's recommendation included grants to help some of those small settings to move to the appropriate setting. So this is the right moment to have more conversation of how do we create a process whereby those small providers can transition smoothly without disruption, and also to be able to give them the appropriate guidance. Right now, if you're assisted living licensure, you go through Minnesota Department of Health, and you have to be paid through the Department of Human Services. The regulations under assisted living licensure are stiff for small assisted living setting. Thank you, Mr. Chair. I renew my motion that House File 2215 be referred to Human Services Finance.
All those in favor of referring House File 2215 to the Human Services Finance Committee signify by saying aye. Aye. Those opposed say nay. Motion carries. House File 2215 is referred to the Human Services Finance Committee. Thank you, Chair Noor. We are now on to our final item of business today. It is an informational hearing on revisor language regarding increasing wages for people with disabilities. This came out of the task force on the elimination of subminimum wage. This was added on because we finally received the language and everything within the last couple of days. So we wanted to make sure that we were able to get an informational hearing to start the process now. So we will not be taking action on this language today, but we wanted to make sure that we're able to consider the proposals, hear from people, and start the discussions on this bill. So Representative Hansen, welcome to the committee, and if you'd like to present your bill, and then we'll move on to testifiers. And I know we've got quite a list of testifiers, and we may have some people from the public, I would think, that'll add on. So go ahead, Representative Hansen.
Thank you, Chair Fisher, and thank you, members of the committee. I know it's getting late in the evening, so stay with me. This is an exciting bill, I promise. Minnesota leads the nation in a lot of ways. This bill addresses a #1 status that we have to acknowledge and reconcile. As of November 2020, we led the nation with the highest number of workers paid a sub-minimum wage. The Minnesota legislature passed a law in 2021 to create a task force on the elimination of sub-minimum wages with the support of people with disabilities and disability rights advocates. And this bill is a reflection of the teamwork and findings of that task force. The time has come to make permanent changes to the use of sub-minimum wages, and I'm really excited to have this bill before you today. And maybe excited isn't the word that others would use, but it's the word I'm using because I get excited about doing the right thing for people whose quality of life is impacted when we don't. After years of painful testimony from people with disabilities on a wide range of issues, it's a good year to be excited because we're making progress and change on a whole lot of issues. And this is one of those big issues to get excited about. Doing our part to help lift more people out of poverty is the right thing to do. Listening to the calls from people who are most impacted by a problem is the right thing to do. And creating equitable economic opportunities for people with disabilities is also the right thing to do. People with disabilities have the highest rates of poverty of any group identified in the census. Less than 16% of people receiving waivered services for disability support make more than $600 a month. Let me say that again. Less than 16% of people receiving waivered services for disability support make more than $600 a month. People living in poverty are at an increased risk of mental illness, chronic disease, early death, homelessness, food insecurity, education gaps, and so much more. The current use of subminimum wages exacerbates these risks for people with disabilities by keeping too many people in deep, deep poverty. So again, I'm excited to have this bill before you because this is a civil rights issue. This is an economic inclusion issue. This is a disability rights issue. Limiting the use of subminimum wages and HCBS waiver employment services is critically important to the work that's ahead of us, and it's the right thing to do. In your handout, you'll see the strategies that were identified and supported by the task force and advocates, so I won't bore you by reading all of those off to you, but I do encourage you to look at them so that you can ground yourself in the reasons and methods used to reach the language that's before you today. And with that, I'm going to turn it over to my testifiers, beginning with Director Grom from DHS to share more about this language. Thank you.
Director Grom, welcome back to the committee. If you'd like to introduce yourself and start your testimony, please.
Mr. Chair, members, my name is Christy Grom, and I'm with the Department of Human Services. And I, first of all, want to express my deep gratitude to Representative Hansen for being so passionate on this topic. We are also very excited to be having this hearing tonight, hopefully the first of what will be several hearings here in the House as this language gets introduced, and then we'll also be moving in the governor's budget. So we do support this bill in front of you, particularly all of the strategies that were recommended by the task force to phase out the use of subminimum wage, including the phase out of the use of subminimum wage, and all of those other strategies and methods that Representative Hansen mentioned. This truly is a civil rights issue. By our assessment, it's definitely a disability rights issue and a labor rights issue. At the department, we have a mission to make sure that we are supporting people to live lives in dignity, and that means having a livable wage, being able to put food on the table, and frankly, sometimes a minimum wage. The minimum wages that we have in this state are not enough, as we've heard this evening, testifiers sharing about their struggles with living in poverty. And so one of the things I want to point out about this particular package is it's bigger than just phasing out the use of subminimum wages. This is a whole suite of strategies and transition plans for providers, for families, for people who might be being paid subminimum wages right now to really plan for that transition to the phase out of that actual wage. So there's nothing in here that's actually taking something away from people. It's actually adding value to the system. And that's why we like to talk about this reform as really increasing wages for people with disabilities and at the same time increasing labor and market participation for those people. A few of the things that are in this bill that I might just mention to be slightly boring are they're exciting. It's bigger than just phasing out the use of subminimum wages. So we're looking at our assessments that we complete for people with disabilities and wanting to make sure that assessors are actually asking people, do you want competitive employment? Do you want to make a change? You're not accessing an employment service right now. Would you like to do something different? We want to make sure that assessors have those prompts and are able to direct people to those integrated services. We want to make sure that lead agencies, our counties, our tribal nations have grants to support their work in transitioning people to competitive and integrated employment. We've got a provision in here that's a collaboration with DEED, where they are creating a disability inclusive certification program under this bill, and they'll be able to train employers, and employers will then be able to say that they are disability inclusive and advertise that and attract more diverse and a broader workforce. We've got some language in here around a technical assistance center to really help providers who are making this transition to be able to do so smoothly and to not have to lose revenue or have any interruptions in service provision. And so really what we're doing here is trying to add more value to the system. We want to make sure people are getting paid at least the minimum wage or the prevailing wage, if not above, hopefully above. And I'll just say finally that these reforms really embody the legislature's intent around employment first. So in 2020, the legislature passed a law that said, you know, DHS, we know that you have this employment first policy. It's something that you say that you do as a state, that you assume that all people with disabilities can and want to achieve integrated competitive employment. But that's not enough for us. The legislature said we actually want to put that in law and require that the Commissioner of Human Services assume that for every person who's receiving a home and community-based service that they do want and can achieve competitive integrated employment. So all of these reforms really embody that goal that I believe the state legislature has, and we would very much appreciate your support and ongoing conversations on this topic.
Okay, thank you. Next I have on the list here, hope I'm going to pronounce it right, Raquel Saidi Wagner. If you'd like to come down, please. Welcome to the committee this evening. Please introduce yourself and begin your testimony.
Give you a great deal of credit. You got it on the first try. So
Thank you.
That's unusual. Good evening, and thank you, Chair Fisher and committee members. My name is Raquel Saidi Wagner, and I'm here tonight as both a member of the Task Force on Eliminating Subminimum Wages and a disability services professional to speak to my support of Representative Hansen's bill that seeks to ensure that all Minnesotans with disabilities are being paid at a wage that's determined by the work, not a diagnosis. For the last decade, I have worked as a disability services provider, managing services such as day support, music therapy, and employment. And my specific role on the task force has been to represent a provider that successfully ended their use of a 14C special wage certificate. In 2016, that provider made the decision to let go of the certificate they'd held for many years in order to advance the stated mission of the organization. As we exited that certificate, 7 of the 8 businesses who were at the time paying people utilizing it made the choice to increase wages to keep their employees, meaning that almost all of the businesses viewed these employees as important enough to their workforce that they were willing to pay them as they do the rest of their staff. The reality is, however, that in some cases, this meant that people lost their jobs. This will potentially be true for many of the current contracts being operated under 14C, which is where you may hear the opposition to this bill raise concerns. That said, in my experience, competitive integrated employment and customized employment offer an opportunity to not only provide an answer to these concerns, but also to meet needs that have likely gone unmet for many years in these settings and under these certificates. As an employment services manager, I watched as people were brought into companies to do incredibly unique jobs that required skills the company had never found in others. Many of the businesses we'd partnered with through the years had chosen to hire one person with a disability, and that person's incredible value to the company pushed them to return to us looking for more talent. During a time when the workforce shortage is impacting so many industries, an often untapped market of people with unique and varied skills will likely experience many fewer barriers to entry than they had in the past. The work that happens within subminimum wage is restricted and heavily limits the choices folks have in their work. People are often only able to do tasks that can be measured for productivity, and they cannot as easily add new tasks or move into new or more challenging roles. As a result, people are often placed in a job that may or may not be the right fit, but that's where they'll stay. How many of us would succeed if placed in a job we didn't like or didn't feel competent in long term? People with disabilities are no different. Customized employment and competitive integrated employment allow for creativity and job search to find the perfect fit. One of my favorite examples of this was working alongside some folks who, with the support of their job coach, found work at an alpaca ranch south of the metro. They love their jobs, and the organization is small enough that it had the capacity to support them, meaning they needed less supports from their employment services moving forward, freeing that staff up to help others find and maintain such meaningful employment. A win for all involved. Finally, as someone who has been through this transition with no resources or support from the state, I can tell you that a lot of the fears and concerns you'll be hearing from providers come from a place of knowing that it is not an easy thing to do. This bill seeks to offer to those providers support in order to make that transition as smooth as possible, with the intention of maintaining the services the people they support need. The task force has submitted a thorough and thoughtful report to ensure that the transition away from subminimum wages is intentional and purposeful, because the disability community and their service providers deserve that. Chair Fisher and committee members, I ask that all of you support this bill as it comes before you this session. Thank you again for your time tonight.
You're welcome. Thank you for being here this evening. Next, we have Larissa Beck. If you'd like to come down, please. Good evening. Welcome to the committee. Please introduce yourself and start your testimony.
Hi, Chair Fisher, members of the committee. My name is Larissa Beck, and I'm here to talk to you today as a task force member, the director of community living for Reach for Resources, and most importantly, as a mom of a child with a disability. My son, Eli, he's 11, he's in middle school this year, and he's on the autism spectrum. I've worked at Reach for Resources for almost 14 years. I had thought when I found out that Eli was on the spectrum, who better than me as his mom? I knew the system, I knew the services that were available, I knew the language, I know how to advocate for him. However, quickly found out it's not as easy as that might seem. We have always thought that we have always fought to be able to have Eli be as inclusive of an environment as possible and treat him with the same expectations that we have for our daughter who doesn't have a disability. We've discovered how hard it is to be able to access the right services that are available, and how the lack of staffing and services to be able to make that happen. This bill helps to be able to create that access, assumes competency, and supports Minnesota's commitment to be an employment-first state. This bill tells Eli that he deserves inclusion and will be included in society. I'm happy to talk about the impact of this legislation from a task force perspective, or about the specific recommendations, or get into the weeds of how this would function from the provider perspective. But I'd like to be able to speak more about this as my perspective of Eli's mom. Eli's world is measured in fairness. Fairness down to the minute of who gets more time watching their shows on Saturday mornings. Because, well, movies are at least an hour and 22 minutes long, whereas a show is only 23. So if his sister gets to watch a movie, then he gets to at least watch 3 shows. There's no arguing about this with him, because this is what's going to happen. This fairness applies to who sits at the preferred seat, which is always on the left side of the counter at the kitchen, and what assigned chores he's responsible for the week. Eli knows down to the penny how much he's earned doing which chore at which ages, and will continually remind me if I haven't paid him promptly, because he is all about the money. Even at 11, the work that he does, even just around the house, has value. And he is well aware of that. He's in 6th grade and beginning to actually think about what he wants to do and what he wants to be when he grows up. Currently, that is either taking over Mojang, which for those of you who don't know are the creators of Minecraft. Very important. Or he wants to be the engineer who perfectly plans how to correctly blow up buildings. That's what I've always thought he's going to be, so I'm glad that that's what he's picking currently. He has big hopes and big dreams, and I can't even imagine limiting his choices of what he could do. We all want our children to dream big and have high expectations for themselves, and know that they can achieve what they dream of. A subminimum wage job would limit his dreams. These types of jobs are things that need to be that cannot be measured by productivity. Are we supposed to then pay him for the number of by the hour, by the worlds that he creates in Minecraft, or by the number of buildings that he implodes perfectly on the strip of Las Vegas when they blow them up? Obviously, the system that we have would not work for that dream that he has. I wonder how many other people's dreams have been limited by this. You'll hear from the opposed people of ending the minimum wage that this would limit people's choices. However, it's my firm belief that this legislation opens the possibility of choices that people have never been offered, as by moving people into customized employment, where people can have employment and the opportunities to be able to get their dream jobs that they're awesome at and make money doing it. I want Eli to grow up being able to dream big, live up to his expectations, and support himself. Thank you.
You're welcome. Thank you for being here this evening, and thank you for sharing. Next, I have Jillian Nelson. If Jillian would like to come down. Good evening. Welcome to the committee. Please introduce yourself and start your testimony, please.
Good evening, Chair Fisher and committee members. I'm Jillian Nelson from the Autism Society, autistic adult. But today I am sitting before you as the co-chair on the task force for eliminating subminimum wage. As Representative Hansen shared, in 2021, we were tasked with creating a plan for how Minnesota could end subminimum wage in 3 years, because this is inevitable. In fact, just this week, it was introduced into legislation in Washington, D.C., and other states have seen litigation to end the use of Section 14C. We knew that Minnesotans, to have the best outcome, we needed a plan here at home. You have all sat in front of me for many hearings this session. You know this is my community. I believe in this legislation and this change with every ounce of my being. If I thought for 1 second that this would harm anyone in our community, I wouldn't be in front of you. This commitment weighed heavily on me as we did the work in the task force. You will hear from people that are saying we are taking away their choice. You will hear that their loved ones with disabilities are incapable of being good employees. You will hear that without subminimum wage, the day programs will close and their families will be left with nothing. This is simply not true. This bill is the most responsible thing we can do for individuals that are currently being paid subminimum wage. This is a plan. This is a path. This is support for providers. This is education for individuals and families. This is how we ensure that subminimum wage is no longer a viable option and that we have secured a meaningful and equitable future for all the people there. And most importantly, to ensure that people with disabilities, regardless of their assumed competency, have equal rights. People with disabilities have a lot to contribute to this world. The work structure of subminimum wage limits those contributions to work that can be measured by productivity. There are many things we can't compare or count, such as customer service, care work, and more. And when we open up the opportunity for people with disabilities to contribute their skills beyond measurable productivity, we open up spaces for people with disabilities in every single employment sector in Minnesota. There are customized opportunities in law offices, in hospitals, in schools, in retail, in every single space. And this is where we belong, in every single space. I have written dozens of versions of this testimony, telling you about my own challenges with employment and how my role is actually customized employment, talking about stats and data from other states across the country. But then this afternoon, I spent 3 hours in the Rotunda. Today was Special Olympics Unified School Day on the Hill, and I was asked to come and teach students how to tell their story. I met students with all types of disabilities: nonverbal autism, intellectual developmental disabilities, Down syndrome. Students whose future could very well include subminimum wage if we don't change this. Every single one of them was shocked and angry to learn that it is legal to pay them below minimum wage. And their unified partners, or their peer without a disability, were outraged that it is okay for the world to treat their friends this way. In that moment, the reason for ending subminimum wage became incredibly simple. How can we make such a concerted effort to engage our students and tell them they belong, teach them to lead, and then let them grow up and tell them they are less than, that they are not worth the minimum standard we apply to other people? If we believe in inclusion that matters in education, if we believe that inclusion matters in our community and where we live, then we need to believe that inclusion matters in our workplace. And inclusion means paying minimum wage or higher. This legislation was designed to lift up providers, to protect choice, and to end an antiquated system that denies basic human rights to a vibrant and amazing group of Minnesotans. I urge you to support this bill and give this community the tools and support needed to make this change. Thank you for your time this evening.
You're welcome. Thank you for being here this late and sharing your story. Next, I have Susan Hanker. If you'd like to come down, please. Thank you for staying this late and being here tonight. Please introduce yourself to everybody and start your testimony.
Thank you, Mr. Chair. I need to read this. I have to use my glasses. For the record, I am Susan Hankner, representing A-Team Minnesota. Thank you, Mr. Chair and members, for giving A-Team Minnesota time to present our perspective on the work of the Subminimum Wage Task Force and its recommendation. A-Team Minnesota is an organization founded by families who have a member with significant intellectual or developmental disabilities, many choosing special wage center-based work option. We are opposed to task force recommendations. We are part of a national organization that has 21 chapters across the country in 21 states. A-Team USA collaborates with other organizations, including Voice of Reason, Together for Choice, advocating for congregate living and workplace choice. Our tagline is supporting a full array of disability service options: my home, my work, my life, my choice. I am a co-founder of A-Team Minnesota. My formal education is in child development, human development, and the psychology of learning. I'm a retired business manager. I have been involved in the evolution of disability services going back to 1974, when there was passage of PL 94142. I have two disabled sons, ages 44 and 49, who are significantly intellectually and developmentally disabled. Per a human development description, they interact with their world from their cognitive, language, social, and emotional ability. Due to brain damage at birth, they are like preschool-age children, with one being profoundly deaf and one with extreme tactile defensiveness. Both are nonverbal. Minnesota law provides for person-centered planning and informed choice, and annual evaluations of one's disability services, successes, needs, where to live, and if they want to work and where to work. This is one of the best laws related to disability services. MinChoices accompanies that annual evaluation and assessment with questions related to this bill. One question is, do you want to work? Another question is, are you working where you want? Through these assessments, a disabled person, their family, or legal guardians determine how the person defines being integrated in their community. The results of these annual assessments are recorded into the state MinChoices assessment tool. A-Team Minnesota supports center-based work options for those who choose it. If anyone does not want it, they can choose something that fits their wants and needs and how they define being integrated. I monitored all task force meetings that were open to the public. A-Team Minnesota met with task force consultants in May 2022, recommending the task force go directly to those most affected by elimination to find out what they are doing, do they like it, and is it their choice. The task force consultant nor the task force followed that recommendation. Last year, A-Team Minnesota supported legislation to include representation of those most affected to have on the task force. Proponents of elimination of 14C oppose that added representation. To date, there has been no objective examination of 14C center-based work options in Minnesota. The task force did not do that. The 2020 U.S. Civil Rights Commission report ignored the 98% of 9,700 comments it received opposed to elimination of 14C. It made only one site visit and interviewed a small number of workers that did not represent the worker demographics. A-Team Minnesota suggests that the legislature request an objective examination of 14C center-based work options to gather facts. that can help with decision-making that helps disabled people. A-Team Minnesota supports planning for a full array of work options from which to choose. A-Team Minnesota respectfully requests that informed choice of individuals be respected and honored. And again, we are opposed to the task force recommendation and this bill. As our A-Team Minnesota self-advocates and their families say it, my home, my work, my life, my choice. Thank you for your time and listening to our perspective.
You're welcome. Thank you for being here tonight.
Thank you.
You're welcome. Next, I have James Clapper. If you'd like to come down, please. And then after that, I have Rick Heller, and then after that, I'll be opening up to other public comments. Welcome to the committee. Thank you for being here this late tonight. Go ahead and introduce yourself and start your testimony.
Thank you. Chair Fisher and members of the committee, my name is Jim Clapper. I'm a parent of a young man with intellectual and developmental disabilities who receives MA waiver support for residential and employment services. I oppose this bill as it will eliminate a legitimate employment choice for at least 4,000 Minnesotans with intellectual and developmental disabilities. Thank you for taking my testimony. My son Bob, this is a picture of Bob, has been happily employed since 2008 in a number of positions, all made possible under the provisions of Section 14C of the Fair Labor and Standards Act. He started his employment in a center-based employment program doing light assembly and packaging in a day training and rehabilitation program near our home. His wages at that time were about $2.30 an hour, which were commensurate with his level of productivity. Today, he works in a mobile work crew in the community at Kowalski's and earns a fair wage, but still under the special minimum wage provisions found in 14C. He has more than tripled his productivity in this time and moved from a center-based employment setting to a community-based employment setting. And we're very proud of his progress, and he's very proud of himself as well. The 14C provisions provided Bob with choices and opportunities to start his employment and steadily develop his skills and work ethic over the last 15 years. If not for the provisions of 14C, he would have had only life enrichment activities in his day training and rehabilitation program. In addition, customers that contract for his work would have moved away from disability employment programs in order to compete. On top of that, his center-based employment program might have closed, which is what has happened in those states where utilization of 14C has been eliminated. Bob's story represents about 5,000 individuals with intellectual and developmental disabilities who are thriving or even progressed to minimum wage under the provisions of 14C. And they will lose their employment if this current draft bill to eliminate subminimum wages succeeds. Just changing a little bit to a more wider perspective, the National Council on Severe Autism did a fair amount of research on this subject. One of their data sources was a case study carried out by the George Washington University, where they looked at what happened in Maine when they eliminated 14C. The council also looked at other states that had done the same thing, including Washington, Vermont, and a few others. Their conclusion, boiling it down to one little line, in short, participants often end up idle at home, not in competitive minimum wage jobs. If this bill succeeds, we will have the same result in Minnesota. Please oppose this bill. Thank you for taking my testimony.
You're welcome. Thank you for taking the time to be here tonight. And next I have Rick Heller. If you'd like to come down, please. Thank you for being here this evening. Please introduce yourself and start your testimony, please.
Thank you, Mr. Fisher, committee members on the Human Service Policy in the House. On March 1st, quite a late night, thank you again. Rick Heller, unofficially represent the Twice Eligible. A few years ago, I used to express the twice exceptional print disabled. Twice exceptional currently is a lingo word in Minnesota Statute 120B15. Also, you find it in the Senate file, Governor's Senate file 1311 on page 27. Also, the governor's striking handicap next to blind and putting print disabled on page 34. Two lingo words, perhaps. I come to support this bill the XXX file. I have provided you a note earlier in the meeting about XX files that they don't become fully accessible for the public until you get them offered on the floor. You'll find some of that on the Data Practice Commission with one of the revisers expressing that back in 2015. There was a digital accessibility report that came out from House File 1962 that was passed in 2019 during special session. I would suggest that you apply that to these hearings, not just you just put PDFs, but make them fully accessible. People manually check them. One example would be the one for Legal Aid Society. Whoever created it needs to manually check these documents. It's not fully accessible with a screen reader and default Adobe. Perhaps other documents. But again, if the legislature wants to be digitally accessible, and those that are here that are talking about handicap and asking for dollars, you might consider having them apply that as well to these mandated documents come back to the legislature. Ms. Weber, the LCC director, spoke at the Lessard about this, and also over in the Senate and Senate Operations Committee about the problematicness of these documents that come to committees, as well as mandated at the Minnesota Library for those that use funding, that Elizabeth doesn't have the resources to check these. It's those that, it's people that create these need to manually check these and do not depend on the checkers. I am excited once again about this bill because in 2018, I don't know if this advisory task committee knew that we signed a global treaty called Moorish Treaty. They took blind and print disabled, two types of handicapped people, found in a federal act called the Higher Education Opportunity Act of 2008, and they merged them because Congress approved and Trump signed that treaty. The new word now is called eligible persons. It seems like we're moving away from the word disc on abilities, perhaps just like the Health and Human Services Department uses people first. Instead of putting a disc on abilities, you might consider if a disc does more disservice. And going back in the 1990s, they had high functioning autism. Once again, I believe that's perhaps part of that twice exceptional group. They have gifts and talents, but also have a disc on their ability called a disability. Just as the FCC, the Federal Communication Commission, mandated the smartphones required to read out loud and be compliant to the World Wide Web recommendations called Web Content Accessibility Guidelines. So this becomes a multi-sensory experience. You get to see it, you get to hear it, and you get to feel it. It's how people acquire information effectively. I think it's very relevant. People do know that the U.S. Department of Labor had a waiver for people with disabilities as well. They have a program called EARN. They're trying to develop, moving away from those excluded individual environments, such as sheltered workplaces, and move them more into the workplace. Because frankly, if anyone perhaps knows about the purpose statement of special ed law amended of 2004, which is education, employment for independent living. If you want to put the spin on it, lifetime learning, gainful employment, and I guess you let you feel in this part about motivation, engaged participation, being challenged in the workplace. I am excited about the word technology in this bill. I haven't heard anybody mention about the 700 with the State Department of Admin. They're currently working on bills now to hold the ADA coordinators more directly connected with the commissioners about their hiring practices. They have failed in that, and they're working on that. I'm sure this advisory report on some minimum wage perhaps has something to do with that. Also, I guess that'll take care of it for today. I'm open to any questions if anyone's interested in in this. I would ask the task force people would get this message and consider if they included that merger that took place in 2018, if that is that the same targeted audience that everyone can be successful for employment. Again, thank you for this opportunity to speak.
You're welcome. Thank you for testifying, and we did get your note earlier, and I know that staff here will follow up with you afterwards on some questions that they have. But thank you for bringing the issues to our attention and for your testimony. With that, I will open up to the public. Is there anyone else here that would welcome? Please come forward, introduce yourself, and begin your testimony, please. And then I've got, okay, another person over there. So. And, oh, I'm seeing lots of hands go up. So if you folks want to come down and start lining up, and then we can move along. So go ahead. Welcome to the committee. Thank you for being here.
Yeah, I'm going to keep my coat on because I'm an old man and I'm always chilly. I'm a little deaf, and I may need 3.5 minutes to share my testimony tonight. So I hope you'll grant me that time.
You've got it. So.
Okay, Chair Fisher, thank you for the opportunity to testify, and committee members for your attention. My name is John Wayne Barker, and I have been in the disability field since 1979, and for the last 25 years, the executive director of Merrick Inc., a nonprofit in Vadnais Heights that provides both life enrichment programs and a full array of work options to nearly 400 adults with intellectual and developmental disabilities. And Representative Hansen, I'm saddened that you're excited about taking the civil right of choice away from people with disabilities simply because their choice does not line up with DHS objectives. It is said that you cannot lift up a righteous cause by tearing down others, and so I won't spend my time stating facts that dispute nearly everything that was said by DHS and members of the task force. Still, it's important for you to know that I understand the special minimum wage issue at a depth those supporting this bill simply don't have. For instance, I know that through person-centered planning processes, people have made an informed choice to earn a special minimum wage. I know that numerous studies have shown that in states that have eliminated the special minimum wage, that most of those impacted did not secure minimum wage work, and many are sitting at home. I know that most of the people earning a special minimum wage have their living expenses entirely covered by Medicaid, and earning a special minimum wage does not result in them living in poverty. I know that VRS has consistently reported over the last 6 years that when asked, more than 90% of the people earning a special minimum wage and their families do not want to pursue minimum wage jobs for reasons that include transportation, socialization, safety, and a real understanding that they simply cannot be successful and or safe in the general workforce. I know that we have 150 people on our wait list that want our life enrichment program and special minimum wage work options and can't find services elsewhere. And I know the self-esteem and joy that clients at Merrick have every day. What I don't know is why anyone would want to take the special minimum wage option away from thousands of Minnesotans with disabilities and over 200 clients at Merrick Inc. who have made an informed, person-centered choice. The National Council on Severe Autism issued a policy statement that included the following quote: NCSA strongly supports a full range of vocational services to allow autistic adults to pursue competitive minimum wage employment. But any coherent vocational policy must acknowledge those with severe cognitive and behavioral impairments preclude their participation in these settings, end quote. Minnesotans earning a special minimum wage have these severe cognitive and behavioral impairments and would not be successful and or safe in the general workforce. I understand a term in this committee and others is, where's the peaceful valley? So how do we find that peaceful valley that honors the informed choice of people with disabilities and their families and at the same time supports those who want to encourage the pursuit of minimum wage jobs. My suggestion is to delete the additions to sections 1, 2, 9, and 13 of this bill, leaving sections 3, 4, 5, and 12 and related appropriations that build capacity through a technical assistance center, lead agency practices, case management training, and interagency collaboration. It is likely that some on this committee have a family member or relative with a disability and understand the real-life experiences of their loved one. Do you really want to take a choice away from them and thousands of other Minnesotans with disabilities? Representative Finke, you have 9 constituents at Merrick earning a special minimum wage. Representative Engen, 10. Representative Kieran, 17. Representative Fisher, 37. Are you really going to take their informed choice away by supporting this bill? There is no need to ruin the lives of so many to build the capacity, and I urge you to delete the additions to sections 1, 2, 9, and 13 of this bill. I'm happy to answer any questions, and thank you for the opportunity to testify on behalf of more than 200 clients at Merrick and thousands more across the state of Minnesota.
Thank you, sir, thank you, sir, for taking the time to be here this evening to testify. Next, and we won't do any questions right now. We'll take all the testimony, and then people have questions is when we'll go to the questions at that point. So next, it looks like, come on up, introduce yourself, and begin your testimony, sir.
Thank you, Chair Fisher. Members, my name is Tom Lehman. For those of you that don't know me, which is probably few, I'm a longtime lobbyist here at the Capitol. This is the first time I've ever testified on a bill, not on behalf of a client. I'm here as a parent tonight. I'm a parent of an adult child with autism, and I'm here to encourage your support for this bill. My daughter's been in a support group for persons with autism since she was in junior high school. She's now 34 years old. She was in the nursing program on an academic scholarship at St. Kate's University after graduating from Minnehaha Academy. And she was doing fine until she got to the clinicals, when she had to start looking at body language, nonverbal cues, those kinds of things, which are so important in healthcare, because people don't always say things, but you can see how they're reacting, and they said, you know, your nursing is not for you. You have a deficit in interpersonal skills, and you don't understand body language, and nursing isn't for you. But St. Kate's, to their credit, said, but you like healthcare, and you aren't good with people, let's switch you into health information management, doing billing and coding in the healthcare sector, but you don't have to interact with people. So that's what she did, and she's thrived. For the past 10 years, she's worked full-time for Frazier in a professional job. Frazier was, as most of you may know, is one of the largest nonprofit providers of services to people with autism and other disabilities. She's not in like a special job for people with a disability. She's in a professional job, 401k, health benefits, et cetera, and she has a disability. She's doing great. She's really productive. Before COVID, they loved, she's now working at home, but before COVID, they loved her. Because on Mondays, when most offices, you come in and say, what'd you do this weekend? Did you watch the football game? She didn't do any of that stuff because she doesn't like interacting with people. She'd come in and go right to work, and she'd work straight through till she was done, and then she wouldn't talk to anybody else, and she'd come home. She's one of the most productive people there. She's a success story, but most of her peers in her support group aren't. These are people who for 20 years have been getting high-skilled, or I shouldn't say high-skilled, but high-quality therapy in Representative Edelson's district at a noted psychologist who specializes in autism and treating people with autism. And these kids, I shouldn't say they're kids, they're now adults, I think of them as kids, are not dumb people. The fact that you have a disability doesn't mean you're stupid. The fact that you have a disability means there's something that you're not proficient in. Each of us have a disability. I have a long list. Patience is maybe one of the big ones. But a lot of her peers are stuck in low-wage, low-skilled jobs even though they're smart. There's a lot of smart kids there, and a lot of smart adults. But having a disability doesn't mean you're stupid. It doesn't mean you aren't worth hiring. How would you feel if your kid couldn't get a job because they had a disability? How would you feel if they were stuck in a low-wage job? How would they feel if they were stuck in a low-wage job? I just earlier this week, and the reason I'm here, I was outside Representative Hicks' office, walking into the work one this week. I saw a woman crying, sobbing, flat out on the ice, on an icy morning. And I went over and it was Representative Hicks, who had just went out. So I stopped back at her office later that day to see how she was doing, you know, because she was in a lot of pain in the morning, and I'm glad to see she's here. And as I was hanging outside her office, I met some of the folks who were supporting this bill, and we just started talking, because we're all waiting for Representative Hicks. Who are you? What do you do? What do you do? And with the autism, you know, started talking. So I went home that night and told Jenny, I met some people today at the Capitol, and they're working on this bill and they're from the Autism Society. And here's what the issue is. She says, that's all we talked about last Saturday at group. All my peers in group wish they could do what I do. They can't get up and go to work in the morning and get benefits and come home and tell mom and dad what they did. They're working low-wage jobs, often taken advantage of by their employers. I'm not saying all employers are bad, but a lot of her peers are being taken advantage of. And they're smart kids. These are not dumb kids. They're smart, good kids. They just have a hard time interacting with people. Jenny shouldn't be the only success story. She is a success story, and I'm very proud of her. But she shouldn't be the only one. And there are a lot of Jennys out there who could succeed if they're given the opportunities. And we shouldn't discriminate against them. And so with that, I'll just say, I encourage you to support the bill. I thank Representative Hansen for bringing it. This is a very emotional issue. Those of you that have kids, when it comes to your kids, that's everything. And for Jenny, it's everything. And I'm here on behalf of her, at her demand that I be here tonight, to say, support people with disabilities and help them become full members of their community, because we have a workforce shortage and we have people who want to work. You know, I'm not the smartest person in any room, that I'm ever in. But I think if you have people who want to work and people with disabilities, we should be able to find a way to fix that. And so I encourage your support, members. Thank you for listening.
You're welcome. Thank you for hanging around tonight and offering your testimony. Is there any, yes, come on down.
Thank you, Chair, and thank you, members, for indulging this. These are really important stories, and so I just want to take a second to say thank you for listening.
Thank you. Welcome back to the committee. Please go ahead and introduce yourself and begin your testimony.
Thank you so much, Chair Fisher, and I really appreciate the indulgence. I'll try to be really quick here. My name is Maren Christensen Hofer. I'm a parent of a child with a disability, and I'm listening to parents talk about this really passionate issue, and I understand that a lot of this comes from a place of fear and a place of scarcity, and parents being very used to be in the position of just feeling like you have to eke out every little bit that you can get for your child. But I think we don't make our best decisions when we make them from a place of fear. And I think that a lot of families, if they are given the information about other options, they will, embrace these things. It is not a choice between either subminimum wage or general employment. There's a whole spectrum of supports in between there. And when families learn about things like MAEPD and customized employment and vocational rehabilitation support, families embrace those things. I think for too long, we've really been fed the narrative that a person's value is based on their economic output. And we are in the midst of a revolution right now that is being led by our children. And that can feel really frightening. As parents, we are being asked to give up the power that we have had to, really grab onto. And that is a very scary feeling, and I get that. But we're not Maine. We have this subminimum wage task force that's put years into work of planning and thinking about it, and it is being led by people with disabilities, and that is something that's really exciting to be a part of. So I urge you to support this bill. Thank you.
You're welcome. Thank you for staying around this evening and offering your testimony. Appreciate it. As I take a look, is there anyone else who would like to testify this evening before I close off public testimony? Not Not hearing any, and I want to say thank you to the committee. We are about to go on, we're going on almost 3 hours here, so I want to say thank you for being engaged and paying attention as we go through here. I do have several folks on for comments and questions. I'll start off with Representative Edelson, go to Representative Hicks, and then Representative Novotny. Representative Edelson, go ahead, please.
Thank you, Mr. Chair, and thank you, Representative Hansen, for this bill. And I want to thank the task force. You know, when I first heard this bill, it was several years ago, and not this bill because we didn't have the task force then. And I shared a lot of the concerns and fear of people. I think I think in the parents that came and spoke, there is fear, and they love their children. I don't know you personally, but I mean, I understand that. But I will say that I really value the work that the task force did here. You know, when you start, I had to remind myself, because I remember in high school, just how segregated things were for people with disabilities, and how I used to go and volunteer in the room with people that had physical disabilities as well as intellectual disabilities, and they would be sectioned off. And so as I'm sitting here and you're proposing the bill, I'm looking at, you know, in the last 60 years, the progress we've made with people with intellectual and physical disabilities. But specifically, let's talk about intellectual disabilities. In 1961, President Kennedy, for the very first time, decided to create a task force to really look at the segregation that was happening in the United States. Before this, families and kids, or any person that had an intellectual disability, could be essentially put away into an institution, locked away, healthcare treatment denied, insurance coverage denied, college, job, that was not even thought of. And so I think of my good friend's son, Henry, who has Down syndrome. And just this past weekend, we went to Gigi's gala, excuse me, my son's always correct me. And we got to listen to exactly what the testifier, Miss Beck, had talked about as a mom. Don't limit me, is what every single one of those kids, these amazing young people who, you know, there's amazing programs for people with Down syndrome to go to college now. I know one of the testifiers talked about somebody working in a grocery store. I think if we limit people with intellectual disabilities as well, if we limit them, we won't see progress. But if we tell them what is possible, and show them, and we will support them as a state, I think that is really the power of what this is. And I just thank you. I'm going to sign on as a co-author. Thank you.
Thank you. Thank you.
Thank you, Representative Edelson. Next, we go to Representative Hicks.
Thank you, Chair, and thank you, Representative Hansen, for bringing this bill. So I don't remember which one of the testifiers said it, but somebody talked about how every year when you do your evaluation, it asks, do you like your job? Do you want to change? Years ago, that started as a pilot when the Fed said you have to start asking that question. And it started as a pilot at SEMCIL. And it started at SEMCIL as the only place in the state that started it. And it started with this woman, me, being the program manager that rolled out the pilot. I rolled that out in 11 counties, and it was duplicated throughout the state. And now it's part of the informed choice process that happens for every person that gets an assessment every year. And when we rolled that out, I sat in meetings where people screamed at me about how asking people if they liked their job was going to change their choices. People screamed at my staff. People called and swore at my staff and swore at me about how asking these people with disabilities if they like their jobs is going to make them think that they can do something else and then they're going to not have a job. And what are you going to do with them then? That didn't happen, by the way. People didn't suddenly do nothing. What did happen was people suddenly did things that they wanted to do. And I would encourage my colleagues around this table to read the actual bill. Because any time we are talking about moving to full inclusion for people with disabilities, the fear of what if, and we must protect, and people with disabilities don't have dignity of risk, bubbles to the surface as misinformation. This bill doesn't say that DWRS rate structure is going to stop paying for in-center support. That's not what it says, right, Christy? Still in here? This bill doesn't say that people who want to do rec and leisure day programming can't do that. That's not what it says. This bill doesn't say that people want to work in an enclave at a grocery store can't do that. This bill doesn't say they can't work at a restaurant. What this bill says is that if they are doing those work tasks, no matter where it is, that they should be paid minimum wage. That's it. It's that easy. It is not about choice. It's about inclusion. The choices are not changing. Minnesota taxpayers are still paying for all of the Medicaid waiver services that provide employment support when this bill passes the same way they are now. The difference is the organizations that are paying sub-minimum wage in using contracts from businesses that are, by the way, paying those agencies to provide those contracts will now have to make sure they're paying those employers minimum wage to do the jobs that they are being paid by business entities to contract to do. That's it. And so I wanted to just clarify what the bill actually says and remind everybody that this is about equity and inclusion and making sure that people are paid for their labor regardless of if they have an intellectual disability, a physical disability, or no disability at all. Thank you.
Thank you, Representative Hicks. I will go to Representative Novotny. After that, Representative Karan and Representative Keel. Representative Novotny.
I have read the bill. And there's a lot of things that we were just told that the bill doesn't say. We were just told a bunch of things that the bill doesn't say. The bill doesn't say much of anything. We're going to set up some programs. We're going to do some lead agencies. I didn't read any of that in the bill. If a person can work at McDonald's, can do the job, and they do the job that someone can do, that's fine. I fully support that. I'd like to talk to you about Jordan. Jordan's very close to me. Jordan has severe cerebral palsy. Jordan is semi-nonverbal. He's confined to a wheelchair and has limited use of his hands. He's been participating at a program at Options in Big Lake, and it gives him a chance to work. I believe he does shredding, and he takes great pride in that. During COVID, he drove his mother crazy to the point where his cousins had to come over and give them both respite time because he wasn't at work with his friends and he wasn't contributing. Jordan's mother that I talked to again tonight told me that if you think it's great, if you think there's a job that you can get where Jordan will be able to make something as a full-time job, then you tell me where it is. It's not a slave labor. I've been to Options before Jordan even started working there, and I saw the pride of many people that were nonverbal, that have limited motor functions. And a place like Options finds something. They go to the community and they find some industry that can, you know, they have a very limited motor skill. Can they do this one thing? And if it's whatever it is, it gives them something to do, and they take great pride in it. And for the ones that could explain to me what they did when I walked the floor and talked to them, they took such great pride because they were able to have this opportunity. And even if it's just putting string through a button or some limited thing, they can do it and they can show up. And even if it's just Jordan pushing a button on the shredding machine, it means so much to him. And before you get all in our face and tell us that we don't understand, I guess I don't understand, because all we get told is we're going to take everybody that's on the spectrum of the disabilities and we're going to apply one size fits all to all of them. And maybe that's where we're frustrated on this side, is that we don't understand how you don't understand. It's not one size fits all. If someone is a high functioning on the autism spectrum and they have the ability to do a job like the one daughter who's doing medical billing, absolutely she should get that opportunity. But what if she's not? How many people like Jordan is going to be? Mr. Clapper's letter, I'm glad he came. Couldn't have said it better. The other parents that were here to talk about this couldn't have said it better. It's one thing, yes, like I said, if they are functioning. What if they're not? I don't understand it. We have a task force that was put together that, surprisingly enough, came to a conclusion of what the task force was put together to come to a conclusion of. I don't understand. It seems like the government's searching for a solution to a problem that doesn't apply to everyone. Are there people that should get a little help? They should get minimum wage? Yeah. I'll say it for the last time. Which one doesn't? So my question to the author of the bill is, what does this all work? There's nothing explaining in the bill how it solves all these problems. It's this euphoric solution to all these problems, one size fits all. How does it work? What is this going to do? What's going to happen? What are you going to do 2 years from now when Jordan can't work?
Representative Hicks. Excuse me, Representative Hanson.
Thank you for the honor. I appreciate that. Thank you, Chair. What are we going to do is we're going to stop paying people less than minimum wage for a job. That's that. Nobody working a job should be paid less than minimum wage. There are some cases in this bill that allow for this, about where sub-minimum wage will remain. Not all of the programs are going away. But in a few years, we can look at Jordan and say, did you get a job that you liked? And if he didn't, we're going to have a better disability system in this state, because there are legislators in this body like me, like Representative Hicks, like Representative Curran, who came here as people fighting for people with disabilities to keep building a better system. There has been so much work done before us. There is not a state of euphoria around this bill. This bill does not just create programs. This bill comes with a very large packet that explains to you the grounding principles that I asked you to look at in my opening comments about how we came to these decisions, how this task force came to these decisions. So I understand that it's confusing. I understand it's a lot. I understand it's a complex topic. We have folks here who are happy to answer specific questions, and plenty of folks who are on that task force. But at the end of this, we will stop lowering the value of the work of people simply because of their ability, the level of their ability. And that matters a whole lot. And I think as a disability rights advocate, it's important that people who have been doing this work for years continue to speak up about this, because you used words that we don't use in the advocacy we do. We don't say someone's, that it's crazy. We don't use those kinds of words, that people are driving their family crazy because they're at home during COVID. We have to be careful and intentional. And I just want to be very clear that This bill is seeking to solve a problem that is happening, a conversation that's happening on the national scale. We're not the only ones working on this. It's not just me, and there's a lot of folks who care a lot about this. I'm happy to have a conversation with you if you'd like to. I know this got added to the agenda late, which is why it's informational only. So it's also going to come back before us. So if there's something about the language that you think we should tweak, change, please reach out to me. I would really appreciate that, and I think that's where we can have a good conversation. But I hope I answered your question.
Right. And as we're having comments here and going back and forth, we should always be careful how we mention people's motives and everything. Let's keep focused on the issue. I know this is very important. There's a lot of feelings on both sides. I think one of the things, and I think Representative Novotny was bringing up, and I think you referred to it, Representative Hansen, is that this bill does allow some other situations to still occur out there. And I'll get to the other people who've got questions here and comments, but I do want to get to that part of the discussion is it doesn't. I've spent some time with Ms. Grami earlier and some of the others talking about the other programs that are out there. And the example I'll use is the day programs, where you've got day programs. And the example I was using is where piecemeal work is done, where they take a look is if the average person does 10 an hour and that pay is $18 an hour, and they do 10 an hour, so that would be $1.80 a piece. Well, if the person does, works for half an hour, does 5 of them, which is, $9, but the rest of the time they are socializing with their friends or they're having some kind of crisis, they're still meeting, from what I understand, they're still meeting the basic minimum wage, because when they're working, they were still getting paid minimum wage here. What it is, it's kind of, if I was understanding it right, it's kind of like the hybrid program. And if I could bring down Ms. Grami, because I think I know what you're asking there, and it's preserving some of these other, the way I understood it was still preserving these other programs that does some of these different things. So if we could get that, and I just want to spend a little time on it because you're bringing up a question, and I know the author is seeing that. It feels like there's more out there. So if I could get Ms. Grami to help explain that out a little bit more so we can get a better understanding, because this is important stuff, and I want to make sure that we're getting this right. So thank you for coming down. And Ms. Graham, if you'd like to go ahead.
Mr. Chair and Representative Novotny, Christy Graham with the Department of Human Services. So, Mr. Chair, you're correct. So this bill doesn't take away that option that Representative Novotny, your son, is participating in right now. In fact, it says we support you continuing to have that choice. And in fact, we're just going to require that you get paid a minimum wage to continue to do whatever it is you might want to do, whether it's work in a kind of congregate sheltered workshop setting, or whether it's using our day support waiver service, which was specifically developed for people who might want to do more of that socialization or might want to volunteer in the community but not want to work. And so there's a variety of services that all of the services currently in place will still be available to your son. All that we're saying is here in this bill is that in 2025, I believe it is, that the use of subminimum wages will be phased out, and instead providers will have to pay people the prevailing minimum wage. So that's the only change in this bill. Nothing is being taken away. That's not the intent here at all, but we do really understand that change is hard, and this is important, and this is why we want to have this conversation, because as a parent, it makes sense that you have so many questions and so much passion on this topic, and we definitely want to support this ongoing conversation. I'd be happy to meet with you as well to continue chatting about this topic.
Okay. Thank you. Anything else that you have questions on? Okay, thank you. Next, I'll go to Representative Coran.
Thank you, Chair. And Representative Hansen, I want to acknowledge and appreciate the conversations that we've had about this. I've shared my concerns from my community with you. So I really, and with Representative Hicks as well, I know the three of us are very strong advocates in the disability services field, and I really appreciate our conversation so far. And I just wanted to, my question is similar to Representative Novotny's question. And I know in my community, the primary concern here surrounds those with extensive cognitive developmental disabilities, paired with very specific environmental and staffing needs. So I guess my question, and perhaps it's for Director Grom, what work is being done to find a way for adults in these situations to earn money while they're still receiving these direct supports in that type of environment instead of like maybe like what we would call a traditional job environment?
Director Grom.
Mr. Chair, Representative Curran, I'm not tracking your question exactly. It's just when you say what work is being done to help people find integrated employment, do you mean through the system, through DHS services?
Representative Curran.
Thank you, Chair. Sorry, so my question is, I know that there's concern from center-based services, like we had testifiers from my community today, and I just wondering if there's anything that you might be able to say to alleviate some concerns that this type of service can't continue the way it's being provided today.
Director Grom.
Mr. Chair, I can start a response, and then Ms. Nelson might want to provide some additional comments. But yeah, so I would say we aren't foreseeing that those types of settings will go away. What we foresee is that providers will continue to work with the businesses that they're contracting with and negotiating the contracts to make sure that they've got enough funding to be able to pay the minimum wage. So we'll continue to have those programs and that option available within our system. I will say there's been conversation today about how this may or may not have worked in other states, and there are many states where this is working. And so while it hasn't been a perfect rollout in every state, not every state has had as robust of a plan as this task force has created. And so all of these strategies, which it might not look like a lot of the words on paper, it's hard to, sometimes look at laws and understand how they play out in practice, but there is a lot of support in this bill to make sure that we continue to maintain all options for people, including those shelter-based workshop settings. And I will ask Ms. Nelson to chime in as well.
Ms. Nelson.
Thank you. Prior to coming to the Autism Society of Minnesota, I was an employment consultant. I do want to start by reiterating, in no way, shape, or form would this change require any of those programs to close. They can continue to stay open. We just ask that they pay people minimum wage or higher. But the biggest barrier for people with the most significant disability is not sub-minimum wage. It is the lack of creativity in the employment sector. I'm going to tell you about 3 people. First, I'm going to tell you about my good friend Latif. Latif reminds me a lot of Jordan when you describe him. Latif has cerebral palsy. He uses an AAC device to communicate, and he has limited mobility. Latif lives in California, not here, but he is currently finishing his doctorate in, I believe, disability studies, and he works very closely with SINS Invalid and has a public speaker. He is a performance artist. His disability has not stopped him for a single second in pursuing his career of his choice. As an employment consultant, I often worked with clients who were coming out of sub-minimum wage. I think of one woman in particular. She had actually been ejected from day programs because they refused to support her in employment because of her behaviors. Because she had challenges, she would get into confrontations with people. She would have very, very large meltdowns because she wasn't receiving the appropriate support. She was on my caseload longer than the average client. But we had to get creative. We tried a lot of things, and some of those things didn't work. One day, I got a call from her, and she told me she volunteered over the weekend at Pride. And she was handing out stickers for an organization that represented her. And I was terrified when she told me this. We had lost 3 jobs in the last 6 months because of her interactions with the public. And I'm like, okay, how did that go? Amazing. She loved it. It was perfect. She felt so connected and engaged, and she realized it didn't matter if someone said no to the sticker because she was just offering them something. That lit a spark in my brain. And 2 weeks later, we were sitting in Sam's Club. Again, she had an interview to hand out samples. This was in 2015 when I left that job. She was in that position for a year. I walked into Sam's Club last weekend, and she's still there. She gave me an extra hot dog. This was someone that was told they were unemployable, that was turned away from these programs, these sub-minimum wage programs, because of her behaviors. When someone got creative and worked in the community, we found her a place where she thrives, she's supported. We looked at what the challenges were in employment and we eliminated them. It doesn't matter if anyone takes the hot dog, just like it didn't matter if anyone took the sticker. The only limit to people with significant disabilities in employment is the attitudes that we hold, the attitudes that their support system holds, and the attitudes that we tell the employers. Employers only believe, and community employers only believe that it is appropriate to pay people with disabilities sub-minimum wage because we offer that to them. If we stop offering that to them, they will pay minimum wage or higher.
Thank you. Representative Karan, any?
No, just thank you. Thank you for clarifying. Appreciate the perspective and the information and the continued work on this.
All right, Representative Keel.
Thank you, Mr. Chair. First of all, my understanding is this bill is coming back to this committee.
I'm not sure what the path is on that yet. I do know that it's got a number of committee stops. I don't know for sure what the path is going to be at this point. But that's why we're doing the informational hearing here. So I've not heard the clear path. Are you saying you'd like to sit back here, or what's the thought? Tell me share with me your thought.
Yeah, I guess I wasn't sure. We don't have a number on it yet. So there's that. And members were, well, I guess most of our members are here, but, you know, there was a division of committee hearing because of the health committee too. Meeting, but I just was wondering where the path was for it, so we're not sure.
I can go to my staff here.
Chair Fisher, Representative Keel, and usually when I do this, nonpartisan staff stops me halfway through, so that might happen again. My understanding is because of the lateness of us getting close to deadlines, it may go to Human Services Finance. I'm not sure if we would have enough time to hear it before first deadline, because it does have other committee stops, but I'm sure that's something we can talk about with the author and others after committee, or tomorrow, given the time.
Okay. Thank you. Then I appreciate that. And then I have a question or a comment maybe. At the lateness of the hour, I'm not going to tell you all of my personal stories about everyone who has worked jobs and has some kind of disability. But in my family, there's long-term different types of things. I think it is well within our understanding to have listened to all of the comments that are made from everyone. As a employer, I actually resent the fact that I get told that I won't accommodate somebody, pay them, provide for them what they need with their abilities. And if they improve or learn to be more successful at the job they're required to do, that at that point I am going to pay them more. I am going to encourage them, teach them more, and as they move on, be successful. And I've watched this happen many times. But when the state comes down and says, oh, by the way, this is what you're going to do, it really becomes a problem. And what it does, and we heard this from many testifiers, I know you can say, oh, that'll never happen, but it does cut off jobs. It does lose jobs. And like Representative Novotny, I had a constituent that called me during COVID and said, Mrs. Keel, please let me go back to work. Please, I just want to go back to my job. It happened to be at a grocery store. They were not bringing everybody back, and his health was not the kind that he could. But he was really struggling with that routine of his life. And this is a huge group of people, from those who have real challenges to those who are autistic and really just need to find their spot. I can't think of her name right now, Dr. She's got autism and she's Yeah, there you go. And how when she developed enough, she was able to do and provide for herself. Some people that we do things for, they're going to get a sub-minimum wage, but we're providing other things for them. We're providing housing, or we're providing care in some point. So I think we really want to think about how careful we are about what it is we're thinking about doing. Because what I learned as a freshman, when we think, oh, well, we'll fix it later, it becomes a program that becomes difficult to manage. And so while we want to care for people, we really need to stop and think about what it is we're doing. So my concern is at the lateness of this conversation in this cycle of what we're doing, that we need to think about exactly what this is. So thank you for my extended not talking too much.
No, thank you, Representative Keel. Representative Engen.
Thank you, Mr. Chair. I think we really did hear compelling stories on both sides of this argument. I think that there are some parents out there with individuals with disabilities, for sons, daughters, who saw that 14C and the provisions that currently exist didn't work for their child. They were able to achieve at what they felt was a greater level than what they were originally told that they could. And that's powerful. I understand that. But then we were also told from other parents that they genuinely are appreciative of 14C because it gave the opportunity in the first place. And we're making a false binary and saying that two things can't be true at once, that we ensure that we're not pitting folks into a program that doesn't work for them or isn't fair, and another that says there is a one-size-fits-all and nobody will be out of a job, nobody will be out of an opportunity or a pursuit of a passion that they can go to, that they can wake up to and know that they have a reason to get up in the morning. Actually, my dad was on the board of Merrick, and I heard about their work years ago, and actually come to find that a couple of coworkers of mine, they also serve on the board of Merrick. And it was never, ever about just the production. That's not what it was about. It was about the people. It was about making sure that folks had a place to go, to interact with peers, to have a support system. And it's so much more than a job. This is a culture. It's a way of life. It's what we all do when we get up and venture through the snow like today to come to the legislature and do work on behalf of our constituents. I think that the false binary, again, is going to assume that those same opportunities for equality or equity, whatever word we want to use, that those still exist with this one-size-fits-all approach. I'm not sure that there is a definitive yes to that question. And that's why I'm concerned. That's why I'm hesitant to say that this is something that's going to be beneficial for the entirety of the community of people with disabilities, because they don't all have the same disability. They don't all have the same strengths, but they also don't all have weaknesses. We need to start seeing them as unique, because that's what they are. It's better when we value them as more than a job. And I think that overall, as this bill sits, it's simply saying that this is about a job. So that's why, as it sits now, I can't vote for this. I wish that there was an opportunity for that to come to fruition, but I just don't see it as necessarily a reality in a lot of cases. So I apologize for the long and drawn-out discussion here, but just wanted to have my 2 cents in there.
Thank you, Representative Engen. And there's no need to apologize. while this was a late ad, what's great is it came on in the evening where we have the time to be able to spend and have these discussions, to be able to hear from people from all sides. This is a big change, and it's a lot of impact. And I think it's one of the things that people are committed to working on it. If there's some areas that we need to get some clarification on, and that's one of the things that we're hearing is that, like when the constituent reached out to Mr. Novotny about Jordan, is having that, being able to take a look at making sure that situation be addressed. And that's why I brought up the discussion on the piecemeal. That's kind of what Merrick does out there. They take a look at what the wage, what an average person would do out there, and those are all paid above minimum wage. And they divide that cost and how many widgets you produce that hour. And so then they take a look at, okay, if it's, the example I had was the 10 widgets, and, if they only made 5 widgets and the rest of the time they're off doing other things and socializing, because that's where it's exciting, is when you see that kind of blend out there. And when I had talked to the folks before, they didn't want to lose that in the process. And if that's not clear, we want to make sure that the work continues in that area so that those things continue to survive out there. This bill is coming out not to end the good things that are happening, but also to elevate where we've got opportunities to bring more dignity, particularly where work is being done. And in today's tight labor market, a lot of employers are good. Sometimes they just have to be challenged, and they'll be able to do it. I mean, we've got so many job openings out there, and this is what it's about: is trying to bring in. We've got 140,000 more jobs than we got people who are available, and we owe that responsibility to figure out how many of these folks can we get trained up to those levels so that they can be fully employed and engaged, because we can't afford not to be leaving them behind. And that's some of the things that I felt, and that's what I was getting excited about, is what are the different things that we're bringing in, the supports to help make those things happen. So, and I hear the concerns that are being brought out from all sides, and I think that as these discussions continue going forward and people getting engaged, that we can have a really good bill coming out that are addressing the concerns out there and providing some great paths for people going forward. So with that, I want to thank everybody for the hearty discussions, the respectful debate going on back and forth. I know it's easy for us to get passionate and concerned. I know some people it's brought to tears. Some people get excited and they're jumping up and down, and others are very reserved because it's scary when we're talking about our kids. So this is something I know that we're going to continue discussions on. Representative Keel will follow up with you afterwards about what will happen on this, because I'm hearing your concerns. We want to make sure we have the time. And it might be taken, like, how do we get waivers maybe on deadlines for this particular bill, so that we might have some space there. So with that, Representative Hansen, I will turn it back to you for closing comments, and then we'll be adjourning.
Thank you, Chair Fisher, and thank you, members of the committee. I know we're all squirrely because it's late and we're getting close to midnight, where nothing good happens after midnight, right? So I just want to say, this is my midnight, I feel like, almost at least. My closing comments are this: people have fiercely defended free labor and undignified work for centuries in this country. They've cherry-picked data to excuse robbing people of their dignity who don't fit neurotypical models or able-bodied molds and norms for generations. This isn't new to those of us who have been studying this issue and fighting for these causes. Let us remind ourselves that separate but equal is not equity. We know better, and we have to do something to do better, because doing nothing is not an option. Thank you.
Thank you, everyone. Thank you, Representative Hansen. And with that, we are adjourned.